Hey, good morning, everyone. Welcome. I'm going to give it another minute or so just for others to join. But it's good to see you all this morning. Let's give it one more minute and we'll begin shortly. Okay, we'll get started. And as individuals come in, we'll welcome them. But good morning and again, welcome members of the public to ELAC, the Early Learning Advisory Council meeting. Just a reminder for those who are new, our virtual protocols are doing each presentation. Please type any questions or comments into a the chat box. Give me one moment. Can you all hear me okay, by the way?
I can hear
Yeah,
you.
we can hear you.
Okay, great, great. Thank you, thank you. Um, and for those who have not, could you change your screen names to reflect whether you are an ELAC member, an RA, or a member of the public? And then we're going to get started with introductions. Let's see. Yeah. And so if you can, after you've changed your name, please share your name, where you're located, your role. And today's icebreaker question is going to be what brought you to this work and what keeps you passionate about supporting children and families. And please feel free to share that in the chat um, as we introduce each other. And I'll just do mine verbally. For those who don't know, I'm Dr. Brian Knows. I sit on ELAC as a chair member. My background is in infant and early childhood mental health, and so that's kind of my focus. And so, kind of what brought me to the role. I worked in a different area of working with children, and found that I enjoyed learning about them and advocating for them. And so that's kind of what brought me to this work. And so, yeah, I'm located here in Seattle. And yeah, I'm looking forward to reading some of the other things in the chat as they come. But again, welcome everyone. Um, we're going to continue to move on. We're going to review the meeting materials. Um, Copies of the last minute meetings were sent out in advance to you to review. But this is going to be your time to ask any questions um, before we get approval on those minutes. And then I'm going to pause briefly for verbal approval on those minutes. Okay, I see a few thumbs up for approval there. Thank you all. And welcome. I'm seeing a theme as I read through the chat. It's interesting how many of us were impacted within our childhood, whether we have children and just found the ease that brought us to this work, or the fact that we had background that we can now bring into this work in a interesting way. So it's funny kind of having those connections there. Let's see. Now, the feedback loop document, I'm going to pause and ask questions. Are there any questions on the feedback loop document that was sent out previously as well? And these are being shared in the chat for those who want to pop it up for a quick reminder. But I'm just going to allow for time to review those. Okay, I'm not hearing any questions on those. So let's go over to state agency partner update documents. Again, I'm going to do a brief pause. That document is shared in chat if you want a quick reminder um, to ask any questions regarding any of those agency updates there. Okay, I'm hearing none. And lastly, any regional correlation updates, questions regarding those updates that were sent previously and is now being shared in chat. And thank you all for those who are sharing. I appreciate Alicia's or Alicia, I hope I'm saying that right, of your reason to see the joy in children and understand the importance and of working with children, the innocence. Just a fun fact, I sometimes I forget, but I think it's important to remember that 90% of that child's brain is, developed from birth into the age of 5. And so being able to work with them at that age to witness kind of them grow in a way, whether it's laughing or through their eyes, like mentioned in the chat. I think it's a reward that we shouldn't take lightly. So thank you for sharing that. And with that, I am going to pass it on to Hannah. Unless there's any questions regarding any of those updates or documents we have, I'm going to pass it to Hannah. Thank you.
Thank you, Dr. Knowles. Good morning, everybody. Hannah Bruning, as one of the representatives for Washington Communities for Children. I'd just like to acknowledge that not all of our regional coalition updates made it onto the document, as there's been several transitions throughout our regions recently, as well as the current challenges that are being faced across the state with the wildfires. So if anybody that didn't get a chance to share on the document who's representing one of the WCFC regions would like to share out verbally, I'd like to give you an opportunity to do that now. I can't see everyone who's here, but I do see Colleen's hand up. Go ahead, Colleen.
Yeah, thank you, Hannah. Um, I also I live in Spokane, so I represent the Inland Northwest Early Learning Alliance currently, and we did not get an update onto the document here, mostly because of myself not getting on top of the task in a timely manner, and our community is heavily impacted right now by the fires. In Spokane and also on the native reservations and whatnot in the surrounding area. We actually have far more acres burning on our reservations than we do. And I would just like to draw attention to that as well. Everybody keeps hearing about Spokane, but there are larger areas impacted and things there. And I don't think that's being brought up very much. And with that, in WELA, so the coalition ourselves, we are in a phase of transition. We are looking to update our charter and our leadership structure. And we had planned a more intensive retreat here the first week of August to get together and make some of those changes and updates. We weren't able to have that happen with the impacts of the fires and things going on with folks locally. So we'll be rescheduling that. So Inwila has been in a bit of a pause phase, I would say, for the last couple of months, but we are still a very connected and close group, and we will get those decisions made and back up and running here in the very near future. Thanks, everyone.
Thank you, Colleen. Also, if there is no other coalitions that would like to share verbal updates, I would like to bring attention to the Child Care Voice Network that just held a meeting on August 6th. So that is the purpose of that network, is to bring together childcare providers, stakeholders from across the state of Washington to move forward in a more reactive to proactive advocacy. And they were working on creating clear long-term goals that are going to help shape the legislative and policy work moving forward. Their September listening session is going to focus on what's top of mind for childcare providers across the state, gathering input for issues such as funding and affordability, regulatory changes to WACs and licensing quality systems, and then workforce and sustainability. November, want to note that in November, they're going to host a panel with legislators on the first Thursday of November. So that's a great place to engage in advocacy if anybody's interested in that. And then I also have the pleasure of introducing some of the new folks, or not so new folks, that we have shifted around with our executive committee. So one of them being Colleen Condon, who just spoke. She is sharing the WCFC position with myself, and is, like she said, a provider out of Spokane. So Colleen, I don't know if you have anything else that you'd like to add to your introduction.
That pretty well covers it. My other hat with WCFC is as the statewide policy and advocacy lead for the 10 early learning coalitions, and I also serve on the board of Washington Child Care Centers Association.
So many hats. Thank you, Colleen. Also, I'd like to introduce Laura Murphy, who is also been recently voted in as an executive committee. She holds the Child Care Center's seat on the ELAC as a member, and I'm going to give Laura the opportunity to introduce herself as well.
Hi, my name is Laura Murphy. I reside in Yakima, Washington. I have 2 centers here. I've been a center provider since 99. I was a home provider from 96 to 99. And I am thrilled to be able to provide a provider voice in this space and hopefully make some impacts and changes that positively affect us on the field. So that's it. Thank you.
Appreciate that. Thank you. Welcome, Laura. Nice to have more Central Washington representation. Also, we have Heidi Walker, who is DCYF's new Deputy Director of Community Engagement. And Heidi, I'll give you a chance to introduce yourself.
Hi, good morning. My name is Heidi Walker. I'm the new Deputy Director of Community Engagement. My background is 20 plus years in child welfare, with the majority of that time spent in partnering with our Washington State tribes. I'm excited to be here and meet all of you in this space and hear what you all have been working on. Thanks so much.
Thank you, Heidi. Nice to meet you. So the next thing I have to talk about is our ELAC office hours. So our space that our executive committee has decided to set up this year is kind of an informal session between the ELAC co-chairs where we host conversations with our members, and that's held in the off months of our ELAC meetings. So this is to create a space for connection, building relationships, sharing different perspectives around the early childhood education field. So these sessions are really conversational. They're definitely member driven. And those insights help inform ELAC's work and the work plan that we develop. So DCYF staff isn't present at these meetings, and the sessions are not intended for DCYF policy or rule questions. They're really just times to reflect and share so that we can gather more information on how to shape our work. So I wanted to provide an overview of the office hours that I hosted in July. On the 27th of July, we started out that conversation focused around the charter updates, and we reviewed the charter with members. There were no additional recommendations offered at that time, so we just went ahead and moved forward with the updates. And really, the conversation centered around quality and licensing. We had two providers and one early learning professional, as well as Senator Harris, attend that conversation in July, and it really focused around subsidy reimbursements, concerns regarding providers serving high percentage of subsidized families, and then having lower compensation levels rather than the true cost of providing care for children. There was conversation around the trip to New Mexico around the early learning study tour. And this was brought up and discussed around how we could have possibly a report on that shared back with our ELAC group. And then Senator Harris also noted that there was substantial child welfare litigation costs that were of an impact or concern. And the additional concerns that were brought up were workforce qualification requirements, DCYF transparency regarding contracts and deliverables. And thank you, Colleen, for sharing that. And also regulatory costs, education requirements, and the burden on our providers. Laura, one of our new executive member co-chairs, was there, and I don't know, Laura, if you had anything else you wanted to share from that conversation. I know the additional education requirements was something that you brought up, and the fact that we have ongoing migration of early learning educators into the K-12 positions due to the low wages and benefits that they are being provided. Are there any questions? Oh, go ahead.
I don't think I have anything to bring up except for I really appreciated being able to meet with Harris, and he seemed to be interested in our field. And so I really hope that we can make connections with more legislators that are willing to take a stand and help us move forward with positive changes in our field.
Thank you, Laura. As I noted, the Child Care Voice Network is a really great place to do that. And again, in November, they're going to have an opportunity with more legislators, including Claire Wilson will be invited to that amongst others. And those are all the updates that I have for our office hours. Our next office hours are going to be held on Friday, September 25th from 11 to 12. And you can find that full schedule available on the ELAC website. And I'm going to pass it back to Marlene.
Thank you, Hannah. I just have two really quick updates. One on the 2026 FSKA report and the ELAC charter. So I'll start with the ELAC charter. The ELAC charter is really what drives the work of the council, and I'm excited to share that it's just updated. There were some copy edits that were made to it, but we were really able to make it more comprehensive. So if anyone were to come to the council and want to learn about it, they can click on this 23-page document and learn all about the council, what it does under the RCW, the deliverables, the members, what members are expected to do, their roles, and then also how we carry out that work of the RCW, some of the logistical pieces. And I know I already told our new folks in the orientation this, but I'm just gonna put it in the chat so everybody has it. And you like if it's I had to refresh my page for it to actually come up, or else you'll see the old one. You should see two hands. But yeah, so we just did a new member orientation at 9 in the morning and was able to share this with everybody. But this is really for everyone here. If you ever have questions on what the council does, what the RCW has outlined for the council's work, how we carry it out, the membership, who sits on the council, everything is outlined in the charter here. The other update is around the 2026 FSKA report. ELAC is tasked under the RCW to create a report to the legislature on recommendations based on the Fair Start for Kids Act. The draft 2026 FSKA report will be shared with members via email. Basically, we've been talking about this for the last couple of years, but because of the budget constraints, this year's report is really going to be highlighting the 2025 report with a focus on goal number 2, which is increasing compensation and wages for childcare workforce. When we surveyed ELAC members, I want to say earlier this year, we asked, hey, what do you want to prioritize from this 2025 report? Given the state's budget constraints. And goal number 2 was the number 1, surveyed option from ELAC members. We are working to put the 2025 report on the webpage. So I don't have a link. However, I am going to upload it here in the chat in case you're just curious. You're like, what did ELAC members ask for in 2025? So here it is. It is a PDF document, and we are going to be putting it on the webpage. And once we share that draft report for the 2026 draft report with members, you'll see it linked there. So stay tuned. That's coming, and we will seek your feedback, most likely via email, or work with our chairs to see if this is something they want to discuss at an office hours. But yeah, it is more to come on this, and stay tuned. I will pass it back to Colleen.
Thanks, Marlene. Up next, we have a presentation from DCYF on the childcare related tools, specifically Childcare Finder with CCA and Childcare Check with DCYF. As a reminder, during the presentation, please type your questions or comments into the chat box. Once the presentation is over, we will answer questions as we can, follow up in the feedback loop when needed, and open it up for additional questions from the presenter. So we have with us Diana Stokes who's the Quality Access Administrator at DCYF, and Michael Nelson, who's the Director of Family and Community Engagement at Childcare Aware of Washington, who will provide an overview of DCYF's childcare tools, including the purpose and differences between the Childcare Finder and Childcare Check.
Thanks, Colleen. Appreciate it. Hi, everyone. My name is Diana Stokes. I will be kicking us off, but before I do so, I'd like Michelle to introduce herself quickly.
Thank you, Diana. Hi, everyone. I'm Michelle Nelson, Director of Family and Community Engagement with Childcare Aware of Washington. And I'm sorry my name shows as Zoom Bravo.
We're here today to really talk about how Childcare Check and Childcare Finder are really complementary tools. But before we do that, we want to provide some foundation in case coordinated recruitment and enrollment is a new concept for you. So if this is new to you, The work itself is not new, but we now have a statewide initiative that is really looking at how do we improve and support how families find and enroll in early care and education programs across the state. And this is really emphasized by Washington's mixed delivery system, just because we want to be inclusive of all options available for families. This next slide highlights what our vision is for CRE. Rather than reading it to you, our emphasis is really on, again, informed family choice. So not just having access to different options of care, but really being informed of what are the benefits of each program option and what is right for me and my child. Besides Michelle and I representing DCYF and Child Care Aware, we also have other partners that are identified on this next slide that also participate in this statewide initiative. We also work closely with the Washington Association of Educational Service Districts, or ESDs, and they are really representing our school districts. At DCYF, we have many different entities within our agency that are represented, such as Child Care Subsidy, our Child Welfare Early Learning Navigators, Early Achievers, ECAP, Head Start Collaboration Office, as well as Office of Tribal Relations. The Superintendent of Public Instruction, or OSPI, is also a key partner in this work as we consider transition to kindergarten as part of our mixed delivery and special education and services. And then our partners at Child Care Aware of Washington, including Michelle, we have our family access managers and our family center to help provide resources for families. Before we get into the bulk of what is Child Care Finder and Child Care Check, I really want to highlight our mixed delivery system because that is where families are looking for different types of care. And as you can see with the slide, if you're able to visually see the PowerPoint, there are many options. This ranges from Head Start, which also has opportunities for early Head Start. We have ECAP. For preschool and kindergarten age, we have developmental preschool, transition to kindergarten, as well as private preschools and kindergartners. We have military operated childcare. We have a lot of military presence throughout Washington State, and many of them have their own child development centers on the installation as well as nearby the installations. Our tribal nations offer different types of care within their communities. We have family, friends, and neighbor providers, or FFN. We have our license exempt care options, as well as our license programs, including child care centers, family child care, outdoor nature-based care, and school-age care. I also want to call out that you can have an assortment of all of these within one facility too, or it may be designated as an ECAP only program or a family child care that offers Head Start services. So it's a really great opportunity to have mixed across the state. But why we're really here, and I know everyone is really excited to know more about, is our Child Care Check and Child Care Finder. So we'll go to the next slide. And this is a quick overview. We have another slide that we'll go over momentarily as well. Child Care Check. I will start here and pass it over to Michelle to talk about Child Care Finder on this slide. But Child Care Check is a tool that helps in the search for quality childcare. This can be used by parents, families, and others to get information about an individual childcare and early learning program here in Washington State. Child Care Check is required by CCDF, and this site supports checking licensing compliance of our early learning programs and finding early care and education opportunities. For Child Care Check, this is a site that's managed by DCYF, so that is one of the key differences here. And then we have the website here as well. And yes, we do recognize that there's a lot of similarities in the website links. Michelle, you want to talk about Child Care Finder?
Yes, thank you again, Diana. Childcare Finder is a complementary tool to Childcare Check, and it actually is an enhancement of CCA of WA's current online family search and referral tool that we've had for many, many years. And so this is really an enhancement um, for family use. We're going to demo the family side for you after Diane and I finish. And so you'll be able to see some of the enhancements that families are able to see about childcare sites. And um, we we have, and when I talk about a complementary tool, regardless of where families enter, whether they find Childcare Check or Childcare Finder, CCA of Law works with BCYF, and we point families to the other resource for additional information. So for instance, if a family comes to Child Care Finder, they will be able to check for the information on Child Care Check that Child Care Finder doesn't have. So it's complementary in the way that these two sites holistically bring the full set of information to families when they're searching for their options.
Absolutely. Thanks, Michelle. And on this next slide, or actually the next two slides, we're really going to break it down of what is included in each tool. And as you initially see, a lot of complementary items that you can see on both. So both will provide the program's name and contact information, the ages of the children served. They will be searchable by current licensing status with just a slight differentiation there. Within Childcare Check, you'll be able to also find closed programs, but within both, you'll be able to find pending and open. And then if a program has been suspended, you'll be able to find that with Childcare Check, as that is very specific to licensing compliance. How long a provider has been licensed will be included as well. As Child Care Check is focused with providing the CCDF information regarding licensing compliance, you'll be able to find valid complaint findings for the last 3 years, as well as licensing inspections for all licensed and certified child care providers within the last 3 years. And then for both, providers have the option of identifying the number of openings that they have within their program, as well as the age group that they have that for. As a parent, that is really helpful, especially if you have multiple children that you're looking to put them in the same care program and not have to be crossing town for options. This next slide highlight some additional features that you will see. So we know childcare programs, if they're receiving state subsidy or offering ECAP services, will participate in Early Achievers. Both sites will highlight their quality level or if they're participating. Both tribal and military programs will be part of these. And programs are able to identify any languages that they're spoken and taught in their program. And you can personalize it. So having a statement highlighting the unique qualities of your program. So really marketing why a parent should come to your program. If you're participating in the food program, and then also having options for filtering for different features. But Childcare Finder has some extra cool tools. Michelle, if you want to talk about those.
Sure. One thing to note about Child Care Finder is that providers really decide what it is, the information that they'd like to share with families through that platform. And there are different ways in which providers can input information to show families more information about their programs, whether it be their philosophy and photos of their site, how they would like to be listed. There, Joanna will, I think, demonstrate this when she does the demo, but there's an interactive navigation map for families. So if, for instance, they're looking along a bus or transit route and are trying to find sites along their route between home and work, there's a way to filter and do that, as well as other features. And the other thing about Child Care Finder is that it gives the ability for providers to interact some with families and vice versa. If providers so choose, they can post their enrollment forms and a wait list and those types of things. And actually, there can be a messaging component added. So there's a lot of flexibility and features with Child Care Finder that allow families to find and engage with you as you would like.
Yeah, a lot more advancement than when I was looking for care several years ago for my kiddos. I wish I had both of these tools back then. As we're gonna do a actual visual walkthrough of a child care finder, just wanted to call out a couple of different things from Child Care Check as we're not doing a full walkthrough here. But as mentioned on the couple of slides, you can filter by your provider type. So for example, we're looking by DCYF license, but you can also find exempt care, formally licensed, and an unlawful care. This is where you'll find program name, the address, and contact information, hours of operation, license status, type of care, age groups, etc. served. And most of this is entered directly from WaCompass as the system that's providing the information. But providers have the opportunity to edit what is not provided through WaCompass. On the next slide, this is if I had clicked a specific program and now I want to find more information. So I can find the licensee name, their number, provider ID number, get their contact information. This is where I can find out if they're participating in Head Start or ECAP, the age group that they're licensed for, again, languages. You'll be able to find their associated school district if they have that listed. And then the key here too is license status. So this is where you would see open, closed, suspended, or pending. So with that, we are going to introduce Joanna, who's another partner from Child Care Aware, who's really our walkthrough guru when it comes to Child Care Finder. She's done this a time or two, but Joanna, I think you should have the screen share opportunities.
Awesome. Thanks, Diana. Hi, everyone. My name is Joanna Cobb, like Diana and Michelle said, and I'm here to show you guys Childcare Finder. And I'm gonna be showing let me share my screen. This is going to be the family search page, right? So this is going to be walking through the experience of what it'll feel and look like to be searching for care within the Child Care Finder tool. So starting here from the home page, right? This is where anyone will first land when they find themselves in Child Care Finder. However they get here, if they just Google care near me and they find Child Care Finder, this is going to be the landing page. I'm here on my big desktop, but I'll mention now that if you're looking at this on your phone, it still looks really beautiful. It works well. It feels responsive on a mobile and on a small device, which was really important to us. And as I just scroll down the page here, you can see that there's more information and opportunities for families to learn more about what are all these different types of care options, right? Like what does this terminology mean that I might not really understand yet? I know that I'm looking for care, but what is ECAP? What is the family child care, right? So hopefully these are some opportunities for families to learn more also about working connections and also to find their way to the family call center for additional support at any time, any type of support that they need. They can do that. So let's go through doing a search here, and you can see there's these first few filters that they get right away. No one needs to enter any personal information to use the tool. It's just completely open. So I'm going to put in my address first. You can see that you can also just enter a zip code. If you don't want to put an exact address, you can just put in a zip code to see the care in a general area. Or you could do along a commute and put in let's say your work and your home, right? And you'll find care that's on that route, which is kind of a cool feature that we really like. And then I'm going to put in the children that I'm looking for care for. This is required. The search won't yield results if we don't know the age of the child that you're looking for care for, right? That's how it works. So I'm going to put in an infant. Obviously, the family doesn't need to put in the exact birthday, but this is so that we can estimate, is it an infant? Is it a preschool? What kind of care do you need? So here we've got an infant. I will show you what it'll look like on the map to do public transportation, but if the family doesn't select any option here in method of transportation, it'll default to assuming that you're driving. But I'll show you guys what that looks like in a little bit. And then we have these two more filters that are here on this initial page. So if if I know that I want to use a subsidy or financial assistance programs like Working Connections, then I can use this filter to only show me providers that are that self-report that they accept or serve Working Connections care. And that can be really helpful for people who are looking, who need that, who need a program that serve that. And then we could select if they want year-round care or school year only. So we're going to run the search here. And this is what the results page is going to look like. You can see it here on the right. We have this map, and this is what Diana was mentioning, this interactive map. So I can zoom in and zoom out and move around. You can see this is my little home address that I put in, and these are all the dots for the care options that are coming up as serving the age of the child that I put in. Along the top, you can see that there's even more filters. And this is a big, I think, advantage and change from other systems is that families can filter. They have a ton of optional control in the type of care that they're looking for. So if they know, you know what, I really only want to see providers that are participating in early achievers, or I know that I need this hours, they can select very specifically the hours of care that they're looking for. So maybe, you know, they just need all the weekdays and they can select with this little dropper the hours and then hit apply and that'll filter their options to only those providers that have indicated that they offer care in those times. I'm gonna click more filters and you can see there's so many, right? So this is all optional, but families can say accreditations. There's lots of flexible hours options. So there's flexible starting and ending times, drop-in care, 24-hour care, and that is something that's verified by licensing, so they can know that they do in fact offer 24-hour care. Curriculum, this is self-reported by providers, right? So they can indicate to families what do they want families to know about their care. Languages of instruction is a big one. Special needs services. Again, this is self-reported by providers, so families can search for that actively to see who has indicated that they offer those care options. Some school age specifics. Transportation. So this is where they could say that they need care that supports with transportation. So lots of control over the search. And then you'll see along the left, I can scroll and see all these care options that are near me. And as I scroll, it'll kind of show on the map, right, like which circle it is that I'm hovering over. And if I click, so you can see, right, that I can just see a few things first about each provider. I can see their general hours. I can see whether or not they have openings available by age group. And if I click view more information, then I can scroll through and see all this other information that they've reported. So I can see, okay, well, what age groups do they serve other than the one that I need, right? I can see more information about their financial programs, all these what we call highlights, which is just kind of specific information that the programs have self-reported. And you can see up here at the top, it'll estimate how many total, how long the travel time is from the address that I've entered to this provider. And I can scroll through and just look at all of them. And you can see this is a good example where the profile for providers is very customizable, where, you know, they can put in specific information that they want the families to know. They can put in photos right at the top. Let's see if there is someone who added photos here. I don't see the provider's photos, but if a provider does add photos, or they can add a video right at the top and it'll appear right here at the top. And providers are really excited about that, about adding like pictures of their outdoor environment, right? Or a little video walkthrough that they can post so that families see that right away when they're comparing care options. Okay, and the last thing I want to show here, I think one of the last things, is if I do select public transportation here, then what that does is, let's say then I click on one of these care options, then the map will show me what the bus line would be to get from my home address to this care. So I would take the 5, right? And then walk through the park. So that seems lovely if I chose that care option. And if it's a longer commute, like let's say this one, it's going to show 2. Oh, and here's some lovely photos. How lovely. Here it's going to show 2 bus routes, right? And so I can know that I would transfer to the 333 right there. So just some cool features. And the map again is interactive, right? So it's like Google Maps where if I zoom in and zoom out, and let's say I'm looking at this and I'm thinking, maybe I could go a little farther north. Let me see what's there. Then I can redo the search. It'll still have all my filters on and I can keep looking at more care options. And the last thing I'll just mention is that you can see these different sizes of dots, right? And what that is like Michelle mentioned, it's really up to the provider what they share and how they share it. And so these bigger dots here are basically saying that this provider didn't want to share their exact street address right away, but they're still here on the map. So this is an estimation of where they are, whereas the smaller dots are the exact street address shared here in the portal. And so let's say, I'm doing my search and I'm scrolling through and I'm having so much fun and I'm looking at all these providers that are available to me and what they offer. If I want to save my list of who I've looked at and who I want to call and who I don't, I can optionally click one of these hearts. And then all I need to enter as a family is my first name, last name, and email address. And then I will be able to come back and log back in anytime. And let me see, I think just log in. Yeah, so I've already logged in, obviously. So I'm going to go ahead and just log in as me. And I can show you what it'll look like to download. So if you put in your email address as a family, you don't have to remember a password that you have to, save on your computer or forget or reset all the time. It'll just send you a code to your email. Which we always hear is more accessible for people than having to remember a password. So I'm waiting to get my code here, and then I'll be able to download this list to a PDF to my computer. Okay, PEGLVY. I can optionally add a cell phone, but it's completely optional. So I'm going to go ahead and skip that. And then I'll show you what is available to me now. Put back in my infant. So now that I'm logged in, if I want to heart this, I can create different lists if I want to. So today I'm searching, it's the 11th. I'm going to create this list. And then I can choose to download that list to my computer as a PDF. And I can also download that list in multiple languages if I need to. Okay. So that's the experience overall of using Childcare Finder. And again, I'll just emphasize that as I stop sharing and check if there's anything in the chat, that this is also really optimized for mobile. And I think that's the cool thing about that interactive map is how much of that you can do on one device. And then if you go to another, and let's say you've saved your search, you can have all your same list of providers there and reach out on a different device.
Thanks, Joanna. And just to call out one more thing, just because the website is not live just yet, we're still working on exactly how Childcare Check will get connected because there are multiple opportunities to have it listed. So as we mentioned previously, depending on where you so if I started at Childcare Check, there will be an opportunity to go to Childcare Finder for more information. And if I started in Childcare Finder, there will be opportunities to link back for Childcare Check if there's more information I want to find out there. And I I'm just kind of looking to our co-leads. It looks like we might have enough time to take a few questions right now. Okay. So Joanna, I am going to give you the first question. There's questions on how a provider can list ECAP openings. So thinking about a program that has a mixed program, I can add openings for preschool, but how do I add for specific ECAP slots?
Yes, that's a great question. So, for anyone who isn't aware, Childcare Finder currently includes all licensed care and any license exempt ECAP and Head Start programs. For mixed sites, the openings are organized by age group. So, if let's say a program had, right, ECAP openings for preschool age children and maybe a preschool age classroom that's not ECAP, or at least, let's say two different sites. One is preschool age openings for that are ECAP, one is preschool age openings that's, subsidy or whatever else. Those are all preschool age openings in Childcare Finder. And then outside of the openings on the rest of the profile, we can see and the family can see that this location offers both ECAP and, private pay and subsidy. And we encourage providers to use the additional information text boxes in any way they want to share that information. We have a classroom that's this and a classroom that's this, but for the openings, we would want all openings, whether it's ECAP or other, to be shared by age group. Thank you for that question.
Yeah, thanks, Laura, for that question. Any other questions? Go ahead, Joanna.
I love that question. Well, so we do have user research and practice from our previous search tools, right? So we know how many, what are the most common search tools that families use before we added a lot more of them. So we know that the financial assistance filters are very, very popular. Also, families really want to know about openings, so those are really common, and hours is really of high demand. And then in terms of use and terminology, we worked with partners and got some initial feedback of what terminology is most helpful for families. How do they think about what these different options are that they want to search for? And it's something that we'll continue to learn from and gather feedback from users as we're launching this tool. So it's been iterative in how we've designed that.
And I'll just add to that, we are scheduled to visit the parent advisory group next month as well to continue getting additional feedback from families. Go ahead, Laura.
Just had a question again about the ECAP slot. So if a family is maybe eligible for an ECAP slot, right, that would be of no cost to them, and they searched for an ECAP opening, would a childcare slot that's just listed preschool come up, or is there a way to search by types of programs?
Right. So right now, and this also kind of relates to that question of how the filters work. Right now, there's a program type filter. So families can optionally filter to just programs that serve ECAP only, or programs that serve ECAP and preschool together, or non-ECAP. We're also adding to the financial assistance filter an option that is, free of charge preschool programs, and that would include ECAP. And then in the future, as we look at adding transitional kindergarten into the site, that would include transitional kindergarten slots. So right now they can filter, and then they would only see programs that offer that. Then the openings that are listed would still be blended, and so then they would need to rely on those text boxes to understand how many of those openings are ECAP, what the eligibility criteria is, that kind of thing. Is that what you're thinking?
I just know that sometimes when a family connects with me about a slot, they are eligible for like an ECAP slot, and maybe they didn't know. And so it would be really nice if families could know which providers offer those and which don't, just in searching, right? So it sounds like there'll be a way to do that for a blended site like mine, right?
Yes, yes, they can filter to see those that serve ECAP. And I'll just add on to what I think you're pointing to as well, is when we're putting that information on the homepage about what care options are, that's where we're hoping some families might learn that they are eligible for those care options that didn't know that before.
Okay, thank you.
Joanna, I'm just going to keep putting these on towards you, and this is all great questions. So thinking about new enrollment and attendance changes, so somebody who's looking for part-time care, so only a couple days of the week, can enrollment be reflected with that flexibility of openings? So maybe somebody's looking for Monday, Wednesday, Friday, but the program only has Tuesday, Thursday that they're listening. Can they get that specific?
Yeah, so right now the program would indicate at the site level, do I offer both, part-time and full-time or part day and full day? But the openings aren't tied to that right now. So again, that's something that they would need to put into a description where let's say the family is searching and saying, well, I only need part day and part-time, right? Then they would see any locations that offer that. And let's say then they could see if they have openings overall. They wouldn't necessarily be able to see if that program is specifically interested in enrolling how many openings are for part day or part time, right? So again, that's the kind of thing that we have to rely on those additional text boxes if that is something that is really important to those openings that the providers are listing. So that's something I think that is something with as changes happen, right? And we continue to adapt that with the CRE group to keep considering those things in the family experience, like how is the system working as those things come up.
Yes, absolutely. If it's not there yet, we can definitely continue the conversations of what would be helpful in the future. Um, I know the importance of this group staying on time, so I just want to say thank you so much for giving us the space to share more about Childcare Check and Childcare Finder and really how they're complementary tools. Jessica, if you could put up our last slide real quick. Just want to share our contact information if you have any questions as follow-ups. This is available in the PowerPoint slide, but our contact information is here available for you, and we look forward to seeing you again in the future. Thank you.
Thank you guys so much for being on and presenting with us today. As a reminder to those on the meeting, we will share a link in the chat for feedback on this section of our meeting today and presentation. Please do take a moment to fill out that ELAC meeting survey for us. And I will kick it over to, you know what, I actually don't see on the screen who's presenting next, but we will close out this part and move along.
I'll go ahead. Hi, everyone. I'm Kara. I'm here with our colleagues in the Early Learning Division to share with you an early care and education statewide access survey. You can go to the next slide.
Hey, everyone. My name is Matt Judge. It's been a while since I've been with you, so I appreciate the opportunity to be in your space again. Just to situate where I'm at in Department of Children, Youth, and Families. I'm in the Federal Initiatives and Collaboration team within the Early Learning Division. And we really have three principal federal grants that are part of the subject of this presentation, or preschool development grant is. So that's one of them. Another is our Head Start Collaboration Office. And then finally, I oversee the Child Care and Development Fund. And then within that, the Cost of Quality Childcare and Market Rate Study, which I'll be talking about in the next presentation. So that's me, and I'll pass it back to Kara for the next slide.
Thanks, Matt. I've already said my name is Kara Lothian. I'm the Early Learning Evaluation and Research Team Supervisor at the Office of Innovation, Alignment, and Accountability in DCYF. I also lead something called an Early Learning Content Collaborative, which is taking all the data nerds together at OIAA who work with early learning data and really thinking across all of the threads of work that take place across DCYF. I'm here with my colleague, Dr. Katie Kuhl, who is the Federal Initiatives Evaluation Manager. And OIAA doesn't get the pleasure of being at ELAC very often, so we appreciate being able to be here. We have 4 main parts of our organization, which I'll just briefly share so you kind of have a sense for what we're doing. I like to describe us broadly as all the data goes in the system, and then it's available to catch in a giant bucket. We're the bucket. We're the people who take care of the bucket. We're the people who can pull things out of it, ideally make sense of it, and provide products to you that are usable and helpful. There's the evaluation and research team, which is us, an analytics and reporting team, a digital innovation and information response team. On our evaluation and research team, we are divided among 3 topic areas. Our team works with early learning. Our team works with early learning and prevention program teams focused on children birth through age 5 to support high quality evaluations and data-informed decision-making. OIAA provides data products like dashboards or reports and conducts research. Next slide. So why are we here today? We want to share something that has been going on in a very quick year of my life related to an early care and education survey. And we want to learn more. I would like your support in being guided in this process. So first, we'll start with the connections. This work is funded by the Preschool Development Grant, and Matt is here to share the connections between the Preschool Development Grant and this work. Next, we'll talk about the survey objectives, and we'll be shaping the results. I want to highlight something. We aren't going to get into the appendices. Katie Kuhl will explain what's there, but we have learned over time that a survey is something that has to be taken with extreme care. And so we have included about 6 different slides and appendices describing the kind of care we took in approaching this work. And we're hopeful that you have access to this set of slides. And so any question that you may have, we're hoping is answered there, but we'll also provide our contact information in the event it's not. Some high-use acronyms: Early Care and Education, ECE, the Preschool Development Grant, PDG. We'll talk about the Early Learning Coordination Plan, the ELCP, and we'll refer to ourselves as OIAA throughout the presentation. Next slide.
Thanks, Kara. So with this slide, I want to make sure that y'all have plenty of background about the origin of this idea for the study. And I really anticipated one basic question from you. Where's this coming from? Did ELAC ever weigh in any way that would suggest that DCYF would engage in a survey like this and ask for your advice on it? And I want to answer that with an emphatic yes. First of all, ELAC has weighed in significantly on the development of the Early Learning Coordination Plan. If you're not familiar with that, it's a strategic plan for not just early care and education, but the entire social safety net, health systems, social services that support families and children toward positive outcomes for kids. And one of the most essential features of that is that there was a lot of community and stakeholder engagement. Really, DCYF facilitated the creation of the Early Learning Coordination Plan. And ELAC weighed in on that plan all the way back to 2019 when it was just being formulated in really significant ways that speak to some of the very priorities that this survey is going to get to. The Early Learning Coordination Plan, or ELCP, has a bunch of these outcome areas, different aspects of child development or health that we want to achieve outcomes in. And there are just a couple that ELAC weighed in on in particular. the positive early learning experiences and positive early learning experiences and powerful communities and responsive early learning system were those two. So way back in 2019, we heard from ELAC that finding out more about family member comfort with the care environment their child in is really important. The ELAC wanted to know more about or advance the priority of family preference and choice in those ECE environments. ELAC was really interested in the trusting partnerships and relationships between parents and adult family members and care providers. Was interested to know, how do parents and family members learn about child development, and was really interested in the priority of matching child need to the options that are out there and how families negotiate the end of benefits that they had been eligible for. So those are all things that I think Kara will explain how the survey gets to, that ELAC has been talking to us about in the formation of the ELCP. Next slide, please. So this one is a similar slide, but on the other outcome area from the ELCP, powerful communities and responsive early learning system. We heard from ELAC in 2019 that we should listen to communities, honor community members as experts in their own experiences and learn more about how that works. ELAC wanted the ELCP to leverage the opportunity to understand how the experiences vary in different locations and locales across the state. Wanted DCYF to create tools that are sensitive and responsive to the different variations in communities, and really wanted us to center family voice for people who have access and those families that don't, and support access and increase it for those families that don't have it already. And of course, just the overall priority of the importance of children and families was something we heard loud and clear. Next slide, please. So how does this all connect to the preschool development grant? Well, this is the federal fund source that would pay for the survey that we're talking about. And ELAC and other groups have been weighing in on the different projects within the preschool development grant from the beginning, but particularly between 2022 and 2024. And we built those projects using that feedback. Back in 2023, we had a planning grant, and already there's more text there than I'll get to, but we knew we had a lot of administrative data. That's data that DCYF already had that spoke to those two early learning coordination plan priority areas. But we didn't have sufficient data beyond that we would need to focus on things like families as central partners in a child's early learning experiences, or those transitions for children and families between programs, and the support for continuity of care in the system. So we knew already at the beginning that we needed more data than we already had. The first year of the grant, 2024, 2025, we identified efforts and projects around integrated and streamlined data on early care and education programs, the workforce, children in care, that we would need to have that to make quality decisions in this space. And then with this current grant year that we're in, the year 2 of the current preschool development grant, this is where we identified this access survey project to look at family preferences, their barriers to receiving services, and really just close the gap in information that we have in some cases. So as I said, all these projects and these priorities were built on, in part, from feedback that we got from ELAC between 2022 and 2024. So all that to say, where this is coming from is really some of the priorities that this group identified. And I think with the next slide, I'm passing it back to you, Kara.
Yeah, I'll actually take over now, Matt. Thank you.
Thanks.
Good morning, everybody. So here we have listed the principal objectives of this survey: identifying barriers and facilitators to accessing early care and education programs across geographic regions and populations, capturing family preference, priorities, and definitions of best fit for care, assessing awareness and understanding of available programs and services, exploring experiences with affordability, wait lists, system navigation, and informing future updates to access dashboards and mixed delivery system planning. And next slide, please. So as Kara mentioned, we do have a host of other documents about this process. As the data folks that we are, it's really important that we track all of our steps and make those available. So these are not in the presentation that we'll share today, but they're all available as appendices. So some of the materials we're including for folks, the timeline of this survey, the context and background, design considerations, the bidder process, data privacy considerations, and the proposal summary. So if you would like access to any of these, you can let us know, and we'll make sure to share for anybody that is interested. Next slide, please. So OIAA, our office, has plans for both the quantitative and qualitative data. This slide is showing our expectations for the quantitative data, the numbers that we'll receive. We hope to use this data for making recommendations to support more equitable access, improving our visualized dashboard estimates related to access, estimating birth to 5 expulsion and its relationship to families of children with complex and special needs, and designing stronger research questions related to the use of multiple care types. Next slide, please. So lastly, for the qualitative data, the words, our office hopes to start this analysis in winter 2026. OIAA did not want this work to be rushed over a year-long contract, so we plan to host community data wallowing sessions. Wallowing is actually a qualitative terminology. It's part of the method that focuses on analyzing and exploring responses as they appear from the data. So not going in with a predetermined idea of what the data will say, but letting it speak to us. So our future ask is to join us. If you know now that this is something that you'd like to work with us in, please let us know. We can come back in the future once we get to this point in the process to ask as well. We would appreciate as wide a reach and perspective and analysis as possible. And that's it for me. Next slide, and I'll pass it back to Kara.
Thank you, Katie. So you may have caught from Katie, this presentation is related to the quantitative results of the survey, and the qualitative results will not be a part of the analysis that will take place this fall. Though that analysis will begin closer to the winter, and it will start as a community-guided process. So this is our slide to share the survey. Jessica has already done that. It's already shared as a link here. I believe it was already shared previously to this meeting. You're welcome to open it up and take a look. But in general, our next steps are to go over it at a high level together. You can go to the next slide. So these are some of the survey components at a really high level. We wanted to do our best. I find with a survey, it can be really challenging to hold on to all the information at one time because it's supposed to work together to really understand what groups of people we are talking about and how we are understanding their experiences. So I've tried to summarize it in a few different ways, with the final slide in this deck being all of the different survey components together on one slide as a source of discussion. So first, the first section is related to childcare arrangements. We ask how many children are in a household and their ages. We ask about their current childcare arrangement, if they have one. We ask about the location, the provider, the price, the hours, and the amount of travel. Some of the questions include if it is in or out of home care, if early intervention or special education services are utilized, the type of early care and education program used. This is just this is a summarized example, but looking at that question, you will see that they are provided in a much greater depth so that folks can answer to their best ability. the monthly cost paid by a family, the distance to care, the hours of care that are needed, childcare arrangements, and if they are meeting their needs, any issues that they have with childcare arrangements, and the likelihood of affording childcare within the next year. The next set of questions is related to preferences, what an ideal arrangement would be. This harkens back to that best fit of care that I'm sure you've heard about throughout the day and will continue to. An ideal arrangement for children who are under 3. We understood that infant toddlers, although we will be able to identify them in this survey, that they have some very special care needs that we don't necessarily have a lot of information on. And ideal arrangements for kids who are aged 3 to 5. The third area is information seeking and trusted sources. This will include what parents and family members consider to be sources of trustworthy information, family communication with providers and early learning professionals, and awareness and the helpfulness of the tools Child Care Check and Child Care Finder, which you just heard about, and information needed to search for childcare. We can go to the next slide. The next section is related to unique situations. The first one is about losing access, finding alternative care, and family impacts. This is an extremely meaty question. I'll point out that it includes expulsion as well as one of those instances in which a family might lose access to care. Perceptions related to qualifying for any kind of financial assistance, finding providers who accept subsidies, experiences with wait lists, which we've heard astoundingly people are very interested in, and we don't necessarily have the appropriate amount of data to be able to understand those experiences, childcare impacts on the employment of family members, and other resources that may be needed to support children. And the final part of this survey is demographic information. We ask questions at the household level, the adult level, and at the child level. For the household, we ask the number of residents and income, the language spoken most frequently, social service assistance received, and any adult who may have utilized medical or family leave when that child was born. We ask adults the year they're born, their education, and their employment status. This actually changed between this presentation. We asked both adults and children their race or ethnicity. We asked children and their gender. We asked for children if they have any diagnosis or delays, and then their first month and year in childcare ever. Then finally, we asked the adults or children if they are members of tribal nations. You can go to the next slide. So the prompt here, and what we would really like support from this group in, is what data should be highlighted to tell the stories of childcare and early learning in Washington State. The next slide captures all the information that's available in the survey, and in general, I would love you to take an eye to that list and think deeply about what do we know or don't know about statewide experiences. What are the experiences of groups of people, specific groups of people we would like to know about and really highlight, or intersectional experiences that could be described in one-pagers that you'd find helpful? From the perspective of the work that we're doing, our contractor will deliver a full set of data to OIAA. There will also be a workbook, a public-facing Excel workbook available that will share the data as appropriate for different regions. Ultimately, we will report out on every region who shares information with us with a high level of data privacy, depending on what different quantities of data we have available to us. And our contractor, as a part of our contract, they have a set of deliverables that are largely defined as one-pagers selected by DCYF. And that's why we're here today. I would really sincerely love to know what sets of one-pagers would greatly serve your work and you believe would support early learning understanding or early care and education access more broadly in Washington State. So as what I'm hoping your reaction after we go through the next example is, I would love to know about families' experience here because knowing about this specific groups of families' experiences with this topic would help me. This area is underreported and it would be great to know about. The reason we did this survey, or we requested it, is because of all those reasons listed by Matt at the very beginning of the slides. So much of this information is underreported and unknown. And there's no better way than to ask folks. And so I truly, although I can look to the data that I know we have available, I know many of these experiences are underreported, but I would specifically love to know how illuminating those experiences might support your work. Okay, next slide for the example. So this is the entire matrix of every question we're asking, kind of pared down into a summary. And the example I'd like to share is, in this example, maybe you'd like to know about the experiences of families with infants and toddlers, particularly families whose young children have special needs. Maybe you'd like to understand their ideal arrangements for care and how affordable their current care is. And what I've done is I've taken a star and I've kind of starred all those areas that I would imagine would show up in a data brief that we would present on this about families with infants and toddlers whose young children have special needs. Okay, final slide. So I kind of wanted to open this up to the group, whether to come off mute or to chat more. What groups, or experiences are really not getting the attention or really don't have the data and understanding that we need to make meaning of it in this work? What groups of people do you work with, or do you represent, or do you support that would be greatly supported by understanding their broader experiences in early care and education? I know it's a huge question. And so if anyone's feeling brave enough to start out small and let us know that something they find interesting, or maybe you even just have questions, that'd be a great opener for this conversation. Yeah, I see a hand up. Senator Wilson? Or, oh, I'm sorry.
Yeah.
You call on them or do I? ELAC, I'm sorry. This is my first time. Is it okay if I call on folks? Go ahead, Senator Wilson.
Yeah, I was just curious around the issue around workforce and Medicaid and the changes coming, and if there's any way to look at, when we ask people if they're employed, if there's a way to also see how many have been impacted by the new work requirement. Is that, I don't know if that's what you're looking for, or not. And then the other thought and the other issue for me is I'm finding we don't necessarily track who's a parent and who isn't, and we define parent differently in many of our different organizations. Like DSHS defines parent one way, DCYF perhaps another way, Department of Corrections another way. And I'm just curious, and I know here it's around the child and the family, but I don't know whether it's a child that may be in the child welfare system, a child who is at home. Anyway, those are some things that I wonder or that I look at, and I just have as a question.
They are great questions. To answer your first one, we will know specifically if families report that social service assistance was received at any point, including Medicaid. We will know if they had any interruptions to their employment, if it is related to childcare, losing childcare specifically. And we will specifically know if losing access to childcare was related to the loss of other services. I don't believe we'll be able to triangulate the Medicaid, the changes to Medicaid that would precipitate that. But I do think we'll learn something a little bit more about that particularly intersectional group.
Thanks.
When it comes to your question related to a parent, we pretty broadly defined it for this survey. We did not follow the way we might define a parent in RCW. What we did is it is anyone who is involved in childcare decision making, which means that we could end up, honestly, we could end up with a grandparent and two parents. We could end up with a really big host of adults who make decisions in this child's life. But the hope was that we could actually, even if a child isn't living in the household, we recognize that we have parents in particular who may have their child one day a week, and then they're trying to scramble to figure out childcare that one evening a week when they have their child. We kind of wanted to understand a little bit more about that nuanced experience, which was the hope of including them. Thank you. I see. Rayshawn, am I pronouncing your name correctly?
Yes, that was perfect. Thank Um, I'm so sorry. I'm gonna try to squeeze in two questions here, but definitely cut me off. So the first question I mean, the first thing I would like to see like maybe a one page or more data on like how many childcare providers themselves have lost childcare or how many pay out of pocket for childcare, even if they work in a program. So even when I was a director, I was still paying monthly for childcare for my kiddos. And so that would be something that I think that we should highlight, especially as we're asking for higher wages for early childcare providers. And then the other one you mentioned, expulsion, and I would love like as Washington State like thrives to like make sure that we have childcare for all. I would love data on like how many children are being expelled and like how that will impact the slots that we have for like even if we had access to be able to provide childcare to every family, like how many kids are losing or families are losing access to childcare by the expulsion rates themselves.
Thank you for both of those. Oh, I'm sorry. Do you have more?
No, I was just ending and saying like I'm happy to talk about that another time. I know those were big questions. So
We actually asked for 45 minutes because we were very hopeful that this would be a conversation space. So I think we can get to all the questions today. In terms of providers who have lost childcare. So interestingly, I will tell everyone a secret. This is just V1 of a mission that I'm on. This is just the first step. If future preschool development grant funding is available, we have made the request that the next version of the survey would be a secondary survey that is aligned to providers. So we would take the results from this survey and reflect them back for the providers. I believe that would be the most appropriate space for your question, particularly because we're not asking about people's occupation here. We are asking about their employment status, but we won't necessarily know about their occupation. But I do think it is a very important area and it's something we're thinking about. But a provider survey, I think we would take a different scope and a different perspective on. But I do want to mark that as something for the future. In terms of expulsion, do I have great news for you? The 2025 FSKA report, which has been held for things related to ensuring that we're following proper formatting for the American with Disabilities Act, which will be available very shortly, does have your first look at preschool expulsion data. So it's already written up. It will be available to you. Bad news, it's not very good. We don't have a lot of it. It's really messy. It will have more questions than answers, and it's not definitive at all. But that is exactly why we want to ask parents. I really want to understand the parent perspective on losing access as related to expulsion because expulsion and soft expulsion is extremely ill-defined. So the good news is we do have providers following that RCW and letting us know about those expulsions, but it's not a lot. And so that information will actually be available for the first time this fall for you. Yeah. All right. Um, Next up, I believe it was Elizabeth was next. I'm sorry if the hands aren't coming across my screen in the appropriate order.
Yeah, thank you. And thank you for this presentation. It's super interesting to see the way that the survey is broken down and the different priorities that you have for this data. To piggyback off of Rayshawn's question, I'd be interested to understand, and particularly when you're thinking about one pagers while also recognizing it's very hard to distill data down to that. I'm also a researcher and I understand that. To really dive into the experiences of families of color around Washington State. What are they experiencing around things like cost, around things like distance to care, around things like access to care provided by providers of color? And then when we're looking at the expulsion rates, how is that um, likely more greatly impacting children of color and families of color? So really pulling that data forward and um, making evident what that experiences are like, knowing that it's not a singular thing. So I hope that was coherent. But I'd be really interested to understand that and to encourage you to really bring that into the data visualization that you provide.
Thank you, Elizabeth. That will absolutely be attainable based on what we have available. And I appreciate the suggestion. Sarah?
Thank you. I'm going to add my gratitude to your presentation and the thoughtfulness by which you're going about this. Um, uh, I'm always seeking to make family, friend, and neighbor care more visible, and wondering how, in your first column, families are able to reflect that multi-care relationship that they have. So they might have someone doing, an hour or two of care before they get to a provider, or like what's that full tapestry look like, and an understanding of like who within their community that is. Is it a sibling? Is it a grandparent? Is it an auntie? Particularly in relationship to siblings, because now we're talking about children and children generally. Relationship to healthcare. So does the family have, like, do the adults have primary care provider? Like, first, do they have access to healthcare? Do they have primary care providers? Do they see a pediatrician on the right? Like, do they have, or it doesn't have to be a pediatrician. Do the children have access to healthcare? See someone regularly? Have they received a universal screening, or do they have access to that? Just all of those relationships with the healthcare system and how that is intersectional support. And finally, building on the expulsion question, if the family is justice system involved.
Some of these, I mean, I'll share with you. You folks have received a draft, and the reason you received a draft and didn't get to review the draft is because we had to make some decisions about how do we execute this in a competitively bid something. We have a year of funding. How can we do this successfully? And we were very lucky that we had an incredible amount of notes and resources from all of the feedback related to the ELCP. So we could build something around that. And then we talked about, but what we really want to do is produce products that people use and people want to share widely and really bring something to the surface. In terms of being able to make FFN more visible, making FFN care more visible will absolutely be possible here. It was really difficult to make a question that really got at, are you using FFN care? And so ideally what people will be able to say is that they're using care in a home, but it's out of their home or it's in their home. And if it is a relative providing that care or if it is someone else. So we should be able to distill it down to getting that FFN group. In terms of relationship to healthcare, that won't be a part of this survey. However, what I have observed recently is there is a young child health survey right now that is being promoted. It's either by Best Starts for Kids or the Department of Health, but it's gotten a lot of traction. And so I do know that data will be available soon. And so my thought is to wait and see what we learn. And if there are some connections, maybe in future surveys. This survey was really built to be timeless. And that was kind of the hope, is that if we take the temperature of the water now, we don't need to do this work in the future to start building a robust survey. It really can be purpose for multiple years into the future. So I'm kind of waiting to see what the results of that are to know what the right question would be when we're asking where childcare and healthcare have their intersections, because some people are receiving healthcare through their childcare and some aren't. In terms of expulsion in the justice system, that's just such an interesting question, and one that I haven't thought about before, but one that has been brought to me before by our colleagues in JR. And I wonder if, as we have a more robust understanding of expulsion, if there is a connection there that we can make with them to start really pulling some meaningful conversations together for those families who who have experiences in the justice system, and also maybe their children are additionally having experiences with expulsion and other systems related to punitive measures. Thanks, Sarah, for letting me think out loud for a second with you. Sorry about that.
Thanks for thinking out loud.
Yeah,
I appreciate it.
And then I'm going to go to Laura, and then I'm going to go to the chat.
Yeah, I just had a question around the new attendance-based billing that's going to be impacting families, and that's going to create a whole new level of expulsion, right? Unintended consequences on families. So I looked at my May attendance, and in May, I serve 150 families. 11 of those wouldn't meet the 16-day requirements, and unfortunately, providers are going to be faced with maybe filling spots if families can't meet those attendance requirements. So um, many of those were either children in CPS custody because, you know, their families are a little unstable. Maybe they lost transportation for a few days. Um, is there a way to add something in there as to if you did lose care, if the reason why was it due to you not meeting an attendance requirement? Because I'm fearful that this is going to impact the very children that we're talking about. Those that have attendance issues are usually kids with high needs. Maybe they get sent home from school, and then they can't come back to care in the afternoon because they were sent home from school for behavioral issues. Or they're children that need to go to ABA therapy and have to miss a child care center. And so child care centers aren't going to be able to absorb the cost of those vacant days. So we're going to be forced with, if you don't come 16 days, in most cases, like we can't hold your spot and we have to fill it. And so these very children that are experiencing instabilities are going to be even more unstable. So I was wondering if you could add something in your survey around that.
At this time, we won't be able to add something, but it should be
Okay.
able to be caught by our qualitative items, which means
Okay.
that we can bring that qualitative lens to it in the wallowing sessions and really take that lens and say, we want to specifically look at families who may have attendance issues as related to WCCC care. That's a code that we can build into our qualitative work to see if we can look for that and if that experience is present.
Okay.
Something you said really caught my mind related to attendance-based billing, expulsion, and CPS custody, which was, does our current definition of expulsion include that kind of expulsion? Like, would that even be considered expulsion under our definition? I'm seeing a thumbs up from Elizabeth. I guess I just asked that question of, even if in maybe some of us do consider that expulsion, I'm not sure if that is defined as expulsion at this moment in time. So I don't even know if as a provider you would consider that expulsion and, for instance, go into Wall Compass and fill out our expulsion form for that reason.
No, you're not going to have to fill it out, but it is going to create
Oh no.
instability. And so I just want to mention that as you're putting together the information. And I'm happy to put my email in the chat if I could join in. So on your work in the future. Thank you.
You're my volunteer. Nicole, I saw your hand up. Is your hand still up?
I was just going to say, I think it's an interesting conversation, and I think we should talk about sort of how we might capture that moving forward. I'm not sure it fits in expulsion, like you're saying, Kara, but it's a space where providers may be making different choices based on attendance. So thanks, Laura, for bringing that up. Gives us some food for thought about how we can capture that.
Senator Wilson? Oh, I said I was going to go to the chat. Nope, Senator Wilson, I
Oh,
already said your name. Go ahead. I'm going to go back to
that's
the
okay.
chat
I'm
after.
so sorry. I know Sarah had mentioned individuals are part of our system. I was just curious about, we have a number of parents both in our JR and our DOC systems. So 18 to 25-year-olds at Echo Glen who are parents. We have parents all over. And I guess that was kind of my question around identifying who parents are and if they are in fact involved in their child's lives and in their decisions, whether they're inside or whether they're in reentry. Is that something that's been considered, or as you think forward, Kara, as you were talking about kind of that JR, that's a space near and dear to my heart. And as we think about early learning, child welfare, juvenile justice, it's all that continuum. And if we can start thinking about that systemically, I would love to know kind of what data might help us and help people understand I don't know, multi-generational systems. There's lots of stuff. But anyway, there are so many un I guess unidentified parents that I know are there, especially as we think about our young ones who oftentimes will leave their children with family and choose to be in a system and rather than bring their children with them. And some of them could have that choice at the women's prison, but choose not to do that. And they then put their children in dependency, which then puts them right into that same cycle. So always trying to figure out kind of how we take a step back and a step earlier. So at any point, would love to have a conversation around that if it doesn't fit in here.
Although this, I highly doubt, unfortunately, this survey will make it to that
Right.
parents. I couldn't agree more. And outside of this set of work, OIAA for, the last 6 or 7 years, there are 8 or 9 early learning data systems that we work to integrate together. That work has taken place and continues to take place, but there's been so many exciting advancements in the way we're able to connect child welfare and early learning data. In fact, we are going to have one of our very first internal reports where we can see the experiences that families in child welfare are having with our early learning system for the first time, which means, the data is a year away from the public. Unfortunately, we need to take our time with it, but we're finally at that place where the data systems that were topic specific are finally at a nice place where we're able to start thinking how those cross-system connections are taking place. So I think your interest is exactly the heart of why DCYF became DCYF, right? Like that really core experience of people who are in those systems and how their family systems connect with one another. It's really important to us too. And I think my hope is the next 5 years is a space where we can really start exploring those intersectional connections. And it's 5 years. So in government, that's closer to 15, but I promise I won't retire without it happening. All right. Let me just check out the chat. Jan shared, I would be interested to understand the experiences of children in foster care and the experiences of children of migrant families. We would as well. We did not ask questions related to migrant status in this survey. You can imagine why, because of the tone and the environment as of recently. There's not a lot of trust for sharing information, particularly through qualitative surveys. But these are experiences that we also believe are important. They won't necessarily be met by this survey, but I do believe we can start thinking about what those experiences, how we might collect that information in a way that is safe in future iterations. A glossary of citation would be very useful in your understanding of usage of various terms. Elizabeth, that's a great idea, and I would love your support in understanding what terms those were. Will the ideal arrangements or other areas include desire for programs with alternative pedagogy or religious affiliation? Will not at this time. There is a question though that is related to cultural fit and cultural match, and it's not specific to a specific pedagogy, but it is specific to cultural and contextual experiences within the child care center, like being aligned to particular philosophies that will be there, but it won't be specific to like this kind of pedagogy. One question I've wondered, not sure if it would cover it, is how many people have not sought out paid care because they couldn't afford the cost? Yes, that is what this survey will do. It is for people who are getting care and not getting care. I don't know if I said that before, but this survey is for everyone. If you are not accessing care and if you are accessing care, and even if you don't want care. So we're asking anybody who has a child in their household under 6 to answer it. We see these high number of children who are not served by childcare providers who have all their parents working, and I wonder how many are of those who would prefer to use paid care and cost barriers. Yes, this should do that. I wonder if families will recognize licensed exempt care as childcare, and then why that is the choice. I am hopeful. This is truly supposed to cover any kind of care that a parent is providing, an adult is providing, any kind of care that a child is receiving. So hopefully license exempt care is captured in there. We tried to use options trust me, this survey started out as like exempt care, license exempt, and then we realized, oh wow, that's terrible messaging and language. Nobody understands what this means, and really took a step back to say, how would a parent perceive this? And how could they make choices that then on our side we could translate it to mean, oh, this is part-time licensed exempt care. Additionally, yeah. Sorry.
I think we have time for one more question and then we have to move on to the next section.
I will just take the chat with me and respond to anyone who needs it because I think I'm over time. But it was great to be here. If you could move to the next slide. Our contact information is there. And if you need anything, please let us know. We greatly appreciate your feedback.
I just need to give a reminder to share feedback in the feedback loop and the meeting reflection survey, and then we'll move on to the next topic. And the next person presenting is Hannah. We'll introduce the next section.
Thanks, Laura. I just want to say a host of gratitude to the three of you for sharing that information about the survey and the really important and thought-provoking questions that were shared. So again, those questions that didn't get answered will be put into our feedback loop. And I appreciate everybody sharing. So we're going to move on to our next presentation, which is going to be from Matt Judge, the Federal Initiatives Collaboration Administrator. He's going to be providing updates on the 2026 Cost of Quality Care and Market Rate Study. So welcome, Matt.
Thanks, everyone. This is my second presentation for your meeting today, so appreciate you having me again. Wanted to give you all an update on the 2026 Cost of Quality Care and Market Rate Study and some of the recent legislative laws that were passed impacting it, and hopefully give you you'll walk away with a good understanding of what's going to be in the study and how it impacts licensed childcare providers' subsidy base rates. So first, I'm just going to get into, I want to make sure that you have a solid background and context around this study and what's in it and why it's important. And then I want to talk about the response rates of the providers who participated in the study, because recent legislation is going to make response rates a condition for using this data to set working connections subsidy rates. I'll talk about the market rates that the base rates that the market data in this study would recommend that the legislature can act on at its initiative, and then the cost model rates that this study would recommend if and when the legislature makes the move to that methodology, and I'll explain both methods. Then I'll talk about next steps for the 2028 study, the next one that's coming up, and I have some questions regarding how we improve and support provider survey response rates on this study at the end for you. Next slide, please. So the foundation, what is the cost of quality childcare and market rate study? So really we're looking at two methods that the legislature can use to set the working connections subsidy base rates. So there is the cost of quality childcare, which I'll refer to as the cost model from now on, just for simplicity's sake, and then market rate data. So two methods, two different ways to set subsidy base rates. To collect all the data that supports both these methods, DCYF works with Western Washington University's Center for Economic and Business Research to survey just licensed childcare providers. So we're looking only at the state-regulated market licensed providers. The survey collects data on the rates that those providers are charging private paying families. That's to go to the market rate side of this study. On the cost model side, we collect data on rent, mortgage, and utilities. We'll call these fixed costs that we pair with all the other information that we already have in the cost model. And that allows us to produce cost model recommended rates, the second methodology. Previously, we did this study every 3 years. It's now required under legislation to occur every even numbered year, so every 2 years. So we have this one coming out in 2026. The next one will come out 2028. Next slide, please. So just to drive it home more, this study is the principal method by which the legislature decides subsidy base rates. And it's now in law that the legislature uses the market rate model or the market rate method to do that. It has the option to switch to the cost model if and when the legislature decides. So when you look at the current subsidy base rates and you see how they vary based on provider type, geography, and child age, that's based on the data that the providers responding to the survey told us about their rates that they charge in the private market. If we ever switch to a model based on cost, then the fixed cost, overhead cost data, rent, mortgage, and utilities, that will impact the rates. So whatever method is used, the study has a significant impact on subsidy base rates. Next slide, please. So just a little bit more about the different requirements for both methods. The federal government, as a condition for the state receiving the Child Care and Development Fund that pays for a lot of Working Connections child care subsidies, we have to set base rates based either on our market rates or some alternative methodology. So as I said, market rate surveys ask licensed providers what rates they're charging in the private market based on region, child age, and the provider type. And then a cost model is one of these kinds of alternative methodologies. And in that methodology, the state would set rates to reflect what it costs a provider to actually provide the care. I just want to make sure that I'm clear that in Washington State, the cost model we developed is highly informed by provider input. They participated in focus groups and provided data and information that created the original model. And that original model had a bunch of variables within it. Because when you're looking at what it costs to provide care, it highly depends. Are you paying your staff a living wage? Are you paying a minimum wage? What are all the other costs involved, and kind of what are the dials set to for those? A group of providers called the Early Educator Design Team, centers, family homes, some tribal providers, weighed in on what those baseline assumptions should be. They recommended that all staff should be paid a living wage. That's the biggest cost driver of all. They argued for strong benefits, professional development, and their assumptions are the ones that we use when modeling cost in this study. So as I've said, Washington, under current law, we set rates based on the market rate survey, or MRS, but we have federal permission to move to that cost model if and when the legislature decides to. This study, we always produce it with both sides to support that option either way. Next slide, please. So with either type, you have to reflect the variation in providers by their geography, the type of provider, center versus family home and others, and age of child. And then we also always have to provide information, this is a federal requirement, on the amount of participation in Working Connections and in barriers what kind of barriers providers say they experience trying to participate in subsidy. The cost model side has to at least analyze the cost of care necessary to meet providers' health and safety requirements, their quality requirements if those are in place, staffing requirements, and cost of higher quality care. And as I said before, the legislature with Senate Bill 5752 in 2025 required us to do this every 3 years, or every 2 years, even though the federal requirement is to do it only every 3 years. Next slide. So more federal or more state legislation that's impactful in this space. So with House Bill 2689, many important things happen, but related to this study are two main things. So it's setting child care subsidy base rates at the 75th percentile of the market. I'll explain 75th percentile, what I mean by that in the next slide, but starting July 1, that'll be the benchmark. Currently, rates are based on 85th percentile of the 2024 study. So we'll move from 85th percentile of the 2024 market rate study to 75th percentile of the 2026 study. And then beginning with the next study in 2028, in order for data from the study to be used to inform future rates via the market rate method, every subsidy region needs to achieve a provider response rate of at least 40%. And if we've already achieved higher than 40%, it has to be greater than the response rate for that region in the prior market rate study. So that's a strong requirement there. Next slide, please. So I promised I would talk about market rate percentiles because I want there to be clarity on that. So why didn't I say percent and not percentile? Or why did I say percentile and not percent? Because they're two very different things. So 75th percentile, as provided for in House Bill 2689, does not mean a subsidy rate that is 75% of the market rate or less than the market rate. It means that the private pay rates of 75% of the slots in a region are less than or equal to the subsidy rate. That means the subsidy rate is better than the vast majority of private pay rates. So a 75th percentile rate is very strong, stronger than 3/4 of the rates out there. 85th percentile is even stronger. So just for an example, a subsidy rate at 75th percentile for toddler care in a location means that 75% of families with toddlers in that location pay the amount listed for the 75th percentile or less. I see some questions in the chat. I just want to assure you all I'm going to get to those in just a bit here. Next slide, please. Here's our regional map. We surveyed all these counties, and they're broken into 6 regions plus Spokane County, which has its own. And then all of our rate recommendations from this study are by region, broken into these 7 regions. Next slide, please. So I want to talk about outreach that was to support the response rate so that we can get a lay of the land with respect to that House Bill 2689 requirement around response rates. So I'll share the response rate data from this 2026 study in a minute. Here's the outreach that we did with our partners at Western Washington University to support providers to respond to the survey. So at the beginning, we emailed the survey with a specific link and QR code for their specific survey that the provider could take. Then we mailed physical letters later, about a week later. Then we started calling through, or Western Washington University employees started calling providers that hadn't yet responded, encouraging them, providing technical assistance and support. Later that month, we sent a reminder email to the non-respondents. Then again, a week later, a reminder postcard. Then start of November, reminder email, just focusing on folks we hadn't heard from yet for the study. Then another set of postcards. DCYF also did some email reminders on our own, put some information in our ECE newsletter, put some information on social media. And then for center providers, where the program has lots of facilities, taking many surveys is not efficient. So we provide an Excel form for those providers to answer the survey for multiple sites more quickly. So that's some of the activity we engage in to support response. And I think on the next slide, we'll see the response rates that we've got. So these are broken up by region. So you can see that some of the regions already in the 2026 survey, most of them actually, already met the 40% requirement. Some nearly 60% here. So again, that legislation is focused on each region needing to achieve that 40% rate and not go down in the next 2028 survey. So the statewide number here is just for your information. And the provider type breakdown is also for your information because House Bill 2689 doesn't differentiate by provider type. All right, so next slide. So what did the data, I'm going to get into what the data told us that market rates were and where 75th percentile of 2026 market rates would land for each of these regions. I want to give you a basis of comparison though. Here are the current rates. This is for family homes. So this, as I said, the current rates are based on 85th percentile of the 2024 market rate survey, and you can see them here by child age and all 7 regions. And if you're a family home provider, yours might be very familiar to you. And then on the next slide, I think we'll see what these rates could look like if the legislature uses them to set rates based on what's in House Bill 2689, 75th percentile of 2026 market rate data. So there's some substantial increases here. And on the next slide, hopefully it'll crystallize more because you'll see the difference between these current rates and what would be recommended by this survey. So just about everywhere we increase, except for Region 6, where we break even, or we stay the same for infants. And then you have one rate, school age in Region 6, that could go down. Elsewhere, there's all substantial increases. So one thing to note, it's currently in law that if the survey says that a rate would go down, that rate will go down. Whereas in years past, rates would never go down, even if the survey data would suggest that market rates had gone down. So that is a change. And then I think we have slides on this for before I move to centers, this is what the cost model side of the study would recommend. And hopefully just eyeballing it, you can see that this is significantly more than the current rates, than the rates that would be based on 75th percentile of 2026 market rates. So just in general, the market won't bear what it would cost, what the cost of care is. So these rates would be substantially higher if the legislature were to move to this method. Next slide, please. So moving to centers, same thing. The center rates just recently increased. They're based on the 85th percentile of the 2024 market rate data. So these are current rates. And then on the next slide, we'll see what the 2026 survey or study data tells us those rates would be if the legislature moves them to this level July 1st, 2027. Really quick, I see a question in chat that I can just answer straight off the bat. Have we already conducted the 2026 survey? Yes, that happened from October through December of 2025. We're calling it 2026 because we're releasing it in the study in 2026. So these are the rates based on the data that we just collected. And then in the next slide, you'll see the difference. Still mostly increases, but you see a substantial number of decreases here. And so what that's telling us is that 75th percentile is less than 85th percentile. And at the same time, market rates in general are moving up over the years, which we would expect with inflation and everything that's going on around the cost of everything. So again, these rates would go down if the legislature changes rates July 1st, 2027. Another quick question, Colleen, do the totals for infant rates include infant rate enhancements? No, these don't include any add-ons at all. This is just base rates. No tiered reimbursement, no registration fees, none of that. Next slide. And these are the cost model rates. Again, significantly higher than either market rate, whether it's either sets of market rates, whether 2024 85th percentile or 2026 75th percentile. Next slide, please. So next steps, we're beginning development of the 2028 study plan with our partners at Western Washington University. Already had meetings with them to discuss the legislation, talk about really two main things that we think would drive increased or sustained response rates. Revisions to the survey to make it quicker, easier to complete, to focus on the essential things that the legislature said we needed to have responses on, and the outreach plan so that providers are aware of the survey, have lots of easy access to it, know when it closes, all of those things that will support them to respond. And then we also talked about the report. Every time we do this report, this study report, we learn how it could be better. So we're talking about the approach there. So for the 2028 study, we would deploy that in October of 2027, and it's a 3-month window that we collect data during. So we'd go October through December 2027, and then release the study report in 2028 on June 1st, of that year. So that's the due date in the legislation. So that's next. And then I think on this next slide, I have questions for feedback. And then I have a number of questions, maybe some of which I can get to in the chat. But these are really focused on how we support the response rates, since the legislature set a requirement to meet certain response rate levels. What changes do you recommend to the survey instrument if you're a provider and you've taken it or you've managed to see it? What kind of changes would make it quicker and easier and boost response rates? Given the response rate minimums and how they keep going up in the legislation, they're going to keep getting more challenging as the years go by to meet. I think a natural question is, what if at some point the market rate part of the survey at least became a requirement for providers? What are your recommendations for outreach to help increase participation? And are there other or additional provider supports needed to help with their ability to respond, or the ease with which they can respond? So I'm going to start jumping into questions in the chat. I see one from Catalina. With the 40% regional response rate requirement, will DCYF be providing updates while this survey is open so our organizations can identify areas with low participation and help encourage providers to respond? That's a great idea. We have been meeting regularly with SEIU 925 during the survey period and letting them know what we're seeing. And I could see other avenues for providing that information if it helps people maybe feel a sense of urgency around completing it or spread word. So thanks for that suggestion. Let's see. Alicia, hopefully I'm not mispronouncing that. I was thinking past surveys were conducted separately for home-based providers and center providers. Are they being conducted at the same time? Yes. And from my memory, we've always conducted these surveys at the same time. You go into your link and you say what kind of provider type you are, and it takes you only to your questions that are relevant to that provider type. So we do all these at the same time. When providers go to do the survey, does it remember what they entered last time? So all they have to do is update or affirm previous info. So that's a great question as well. So in the last 2 surveys, we had specific links for providers that we sent specific emails to. And then when we had generic communications, we had a generic link that providers could use. Always in the case of a specific link or a specific QR code, meaning one that's specific to that provider, they could take the survey, and if they make it halfway through, they could close the window, close it, shut the computer down, open it back up the next day, and pick up right where they left off. So yes, in that case, always. In the case of the generic link, in some cases, they were not able to do that. We were not able to keep I don't know how that works on the technical back end, but in some cases, you could lose that info if you didn't complete it in one sitting. For that and other reasons, I think we're strongly considering not using generic links anymore and just really making sure that we do as much outreach as possible with a provider's specific link so we can always ensure they can always pick up if they have to stop in the middle. And Alicia also asked about what current outreach looks like. There's a slide where I talked about all the different things that we and our partners do: physical mail, email, postcards, phone calls, DCYF newsletters, social media. So I'll provide the slides so you can take a look at that and specifically later.
And Matt, we have a couple of questions in here about sort of what happens with the requirement of the 40% response rate, the 65%. So folks are asking, what happens once we achieve 40%? What if we get to 65? What if it was 100%? How does that impact how the legislature might use this data?
So under House Bill 2689, as long as we meet these minimums, then the legislation says that that data can be used to set rates. What happens in the case that we don't meet that response rate for a given region? I really can't say. The legislature has a legal authority to set rates, and the legislation simply says that to set rates using the market rate data, that response rate needs to be achieved. What the legislature would do in the case that it doesn't, I'm not sure. I guess I would say that I intend not to find out by working as hard as I can to support providers to respond and meet those minimums. If we reached 100%, we'd have, and all the data was good, we'd know with 100% certainty what every single provider's rate was, and the data would have 100% reliability instead of 99% reliability. So that would just be an amazing outcome, and the legislature could obviously use the data to set rates. Let's see, Courtney asked, did the 2026 survey allow for multi-site provider to enter across multiple sites at one time? Yes, we provide a spreadsheet instead of the survey because that's actually a lot quicker for sites that have lots of, like centers that have lots of programs, lots of facilities in their program. So yes, we do that. Could DCYF work to remove redundant information requested on our annual paperwork because staff info is already in merit and instead we require we share our rates? Yeah, I think that's a great suggestion. And I think that's what Western and DCYF are talking about, is just zooming in on what absolutely we don't have that we must have to meet that response rate requirement. And that really is down to what are the rates you're charging for private pay and removing as much else that we don't have to have, at least for that portion of the survey that's required to have a response rate minimum. And then Alicia said, based on my reading of the legislation, they cap the increase at 65%. So once a region hits 65%, they only need to continue to meet that same benchmark to continue to be meeting the requirement. Yes, that's correct. Laura said, providers must complete annual renewal paperwork. Could this survey be simplified in a part of the annual renewal paperwork? Then all annual updates could be uploaded to the end of the year to complete the survey since renewal dates vary. That's a really interesting suggestion. My only initial wonder about that is that the federal government requires that the survey be a point in time so that we're comparing apples to apples. Like we didn't get a rate in January of a year and a different rate in December, 12 months later when the economy had totally changed. Maybe it changed significantly in that area. So the feds require that we do this within a 3-month window. So if renewal dates are all over the place, that could be that'd be something to work on. Colleen said, I have felt for a long time that instead of requesting staff information on that paperwork, we should certify that our merit is up to date, in which case it would take me less time to share my rates than I'm spending currently. Yeah, that would be easier and more efficient. Catalina said, Region 1 is entirely rural, very few providers overall. What happens if the region does not meet the threshold? What data will be used to determine rates? And that's honestly, I don't know what the legislature will do. The ball will be in the legislature's court. They have the legal authority to decide how to set rates if a region doesn't meet the response rate minimums. The fortunate thing in that case is that if we can get with follow-up contacts to providers in locations where there are only a few, if we can just get a few to finally respond, we can really move the response rate significantly with each response. Sarah asked, does the survey include a place where providers can indicate what is driving their rate changes? For example, insurance, utilities, staffing costs, balancing income when receiving less than 100% subsidy. We do ask about what their insurance rates are and utilities are, and have asked about staffing costs. Some of those things drive the cost model. I think the thing that we're really trying to balance now is how do we make this survey as short and easy to complete as possible so that we meet the response rate requirements. There are many things that we would like to know that are very interesting and helpful to know. And the question is, how do they impact whether providers will finish the other parts of the survey that are mandatory? So I'll think on that. Hannah asks, are early achievers coaches allowed to support providers filling out this survey? Many providers need technical assistance. I think that's something that we want to explore with the 2028 survey. How can we engage coaches more? What's going to be supportable in their capacity? And how can they help with response rates? So yes, that's something we'd like to look at. And then Laura suggested maybe all renewal dates could be changes to fiscal year that update in July. And then thereafter, the provider could do this as part of their renewal process, since it appears most providers adjust their rates in July yearly. Yes, that's an interesting suggestion. So I will take this feedback with me and use it in the conversations we're having with Western as we design the survey and outreach. So I really appreciate the engagement here. And here's my contact information if you would like to reach out with any questions or thoughts.
Thank you, Matt. We really appreciate your breaking that down. There's a lot of information there to absorb, and yeah, really appreciate you taking the time to ask those questions to how we can support. We're going to go ahead and take a 15-minute break. We know this is a very long. Make sure you take care of yourself, and we'll be back at 12:35.
Okay, we're going to re-adjourn our meeting. I'll give everyone a chance to kind of log in or log back on. Okay, I'm going to move forward with the Early Learning Facilities Grant. As a reminder, during the presentation, please type your questions or comments into the chat box. Once the presentation is over, we will answer questions as we can or follow up in the feedback loop when needed, and open it for additional questions from the presenter or the presenters in this case. Next, I'm going to present Tracy Schreiber and Christine Ramos from the Department of Commerce. Tracy is the Access and Facility Community Liaison at DCYF, and Christian is the Program Supervisor at the Washington State Department of Commerce. They'll provide updates on the Early Learning Facilities Grant, including the legislative context, the advisory group, and the collaborative efforts between DCYF and the Department of Commerce. Again, as a reminder, please share the feedback via the meeting reflection survey for this topic. We'll have that link in the chat. And with that, I yield to Tracy and Kristen.
Awesome. Thank you, Dr. Knowles. My name is Tracy Schreiber, and I'm here today with my Department of Commerce colleague, Kristen Ramos, and we're going to share about the Early Learning Facilities Grant. We were really excited to hear that there was interest to learn more about this grant program, and we really appreciate the opportunity to be here with you today. Next slide, please. To get us started, we're going to ground ourselves in the ELF RCW that establishes the foundation for this grant program. And then we're going to share about the ELF Advisory Group and their purpose. Kristen's then going to provide a deep dive on the ELF program. And then prior to the question, answer, and comment period, I'm going to be talking about how DCYF supports early learning facilities and in connection to the grant. Next slide, please. So ELF was established in 2017 under House Bill 1777. Department of Commerce is the lead agency that administers the grant, and the grant is intended to support DCYF's access goals for slots for ECAP and for Working Connections childcare. ELF is a commerce grant, and that legislation determines eligibility and program activities. RCW dictates various requirements for the grant, and that includes the intention that classrooms be used for subsidy and ECAP, and it also defines the organizations eligible to apply. The types of eligible grant activities, including pre-design, pre-development, major construction, renovations and repairs, and emergency grants are also specified in RCW. And RCW specifies that the resulting program participate in early achievers and requires that that site is under the grantee's control for a minimum of 10 years. Commerce and DCYF collaborate on a legislative report every biennium. Next slide, please. The ELF Advisory Group is also established under RCW. The advisory group is convened by Commerce, and it meets monthly to advise Commerce on program policy issues. They also review grant proposals and approve the list of awards to be distributed overall. RCW has certain membership requirements, requiring representation from DCYF, OSPI, the Washington State Finance Commission, and organizations certified by the Community Development Financial Institutions Fund. The financial institutions are represented by Enterprise and Washington Community Reinvestment Association, or WRCA. Additional members include Yakima Community Foundation and King County. And so now I'm going to pass it over to Kristen from the Department of Commerce, and she will go over the ELF program in more detail.
Hi there. I just want to make sure you guys can hear me. Can you hear me today? Okay, perfect. I'm Kristen Ramos, and I'm the Early Learning Facilities Program Supervisor for the Department of Commerce. And I was asked to provide some information about some requirements, how to apply, and to answer any questions you may have. So thank you for having me. Next slide, please. For eligible organizations intending to increase subsidized capacity or maintain current capacity, the application period opens in the fall of odd-numbered years. All learning organizations may apply for these grants with the exception of public school districts and tribal compact schools, who may apply for maintenance funding as they have their own round opening in the spring of even numbered years. Next slide, please. So the application period generally opens in the fall of odd years, with the materials being made available on our website approximately a month prior to the application opening. The application period is open for 6 to 8 weeks. No applications are able to be accepted, no late applications are able to be accepted for any reason. So we highly recommend that no one wait until the last few days to open an application or submit. Commerce isn't responsible for internet lags, computer failure, internet issues, or any other reason. So feel free to share this information about this funding opportunity with your early learning community to help expand intended, subsidized, or maintain early learning capacity. We will have the following resources on our website in the July-August timeframe. The program guidelines outline the general terms and requirements for the grants. The Notice of Funding Opportunity informs interested parties how to best prepare for the grant and has tools at the end to help the applicant write a scope of work and develop a budget, among other tools. The actual application questions that will appear in Zoom grants are also in the Notice of Funding Opportunity so that applicants can do the research ahead of time and be able to complete the actual application easier. The special terms and conditions from the contract are also included as an attachment, because successful grantees will need to enter into a contract with Commerce for reimbursement. We have made a slight change from previous rounds. Expectations for securing a grant will only be if the grant is $250,000 or more. And we will have that information on the website as well. The program guidelines, Notice Funding Opportunity, frequently asked questions and answers, and outreach presentation slides will all be translated into Spanish and Somali and posted on our website. The actual application and Zoom grants, the pre-contracting processes, reimbursement, and closeout are only in English. The Early Learning Facilities Program will be offering live technical assistance office hours, with those days and times to be posted on our website. Any questions that attendants have when there's not enough time to answer can be submitted in writing to Early Learning Facilities at commerce.wa.gov, or the interested entity can attend the next session. We have yet to be in that situation that we generally are able to answer everybody's questions live. We highly recommend that any interested party review the program documents on the website prior to attending the office hours, because most, if not all, questions are answered in these documents. Although office hours can assist with explaining what the processes are and answer questions about the funding round, we can't provide specific responses to the application questions themselves. Next slide, please. There are some exciting updates from previous funding rounds. For the last round and this current round, there are no matching funds requirement to be eligible for funding. However, if the applicant intends to contribute non-state dollars for the project at the time of application, then those dollars will be contractually required to be provided. The budget provided on the application is the budget we are going to be using in the contracts. For grants less than $250,000, securing the grant through real estate liens will not be required. Documentation of site security in the form of a deed or long-term lease with written permission from the landlord to make modifications will still be required at the time of application to ensure that the project will be able to proceed on the property as indicated in the scope of work. Next slide, please. So we're combining all available funding to be run at the same time, but with two separate applications this time. We're going to have an application for expansion and an application for maintenance into one round, but they'll each have their own application. One application will be for projects expanding capacity, and the other will be for projects that are maintaining capacity. There is no limit to the amount of funding being requested. However, to be eligible for scoring, all funding requests must be supported by official bids, estimates, or quotes by licensed vendors or contractors. Next slide, please. For the expansion projects, the Early Learning Facilities Program is proposing just two funding categories. Pre-development, which was formerly divided into two categories of pre-design and pre-development, will include all planning activities up to the point of groundbreaking, and the major construction, renovation, and acquisition category will be a separate category. So we're trying to make it easier this funding round So we'll be combining the pre-design and pre-development, and just all the groundbreaking activities will be into one, and then the construction in the other to avoid confusion. So if you're in the idea or planning phase, it's best to start with that pre-development. Or if you have an idea and you're ready to work with professionals to complete feasibility studies, identify appropriate sites, confirm zoning and other activities, that's also in the pre-development category. If you're ready to break ground and you have everything approved, ready to go, then you would apply for construction. So in the construction phase, you're ready to start actually building the project. For acquisition projects, the grant can cover up to 75% of the acquisition costs. That's just to make sure that the value of the property is supported. So the grantee would need to bring 25% of funds to the table for acquisition. It's not a match requirement. That's just the policy of the program. Funds are wired directly to escrow at closing. So we don't reimburse previously acquired properties. They have to be purchased, after award, and then we wire the funds at escrow. Next slide, please. So with the maintenance funding round, there's just that one category, minor renovations, very simple. And that application runs concurrently with the expansion projects. Renovations can only be for the early learning facility portion of a site. So if there's a facility that's 2,000 square feet, but the early learning facility portion of it is 500 square feet, then if they're redoing all of the siding or the entire roof, we'd only reimburse 25% of that, because we can only use the funds toward the early learning portion of the facility. So if there are also updates or repairs to a facility, the replacement materials should be similar in nature to those being replaced. Next slide, please. So another type of funding provided by the legislature is in the form of a direct appropriation. These funds are awarded directly to the organizations by the legislature. The funds are generally requested by an organization through their local elected official and supported by lobbyists in the community. The capital budget also provides funds in the form of grants and loans to the Washington Community Reinvestment Association, WCRA, Enterprise Community Partners, and Craft 3. These vendors provide assistance with project gap funding and project funding themselves through grants and loans. They're also coming up through Enterprise Community Services, an emergency grant funding round. They were given $3 million in the last capital budget that are going to be available on a first come, first served basis for emergency repairs. That program is currently under development and will be released and run by Enterprise Community Partners. So keep your eyes open for that as well. Next slide, please. There we go. To receive funds, all successful applicants will need to enter into a contract with Commerce. Program managers are assigned to the successful applicants to assist with the pre-contract requirements all the way through reimbursement and closeout processes. All awardees must adhere to that 10-year commitment to provide services. If an awarded facility closes or stops services before the end of the commitment period, the awardee will be required to return funds on a prorated basis. This is to protect the investment, to get the return on investment of the state taxpayer dollars. So, for example, if there are 2 years remaining on a 10-year commitment period, the awardee would need to return 20% of the awarded funds. Now, this has only happened in very rare cases, and it only happened so far in one competitive round and one of the federal rounds. So it's very rare out of 600 plus contracts that this happened. At some point during the project completion or afterward, Commerce staff would like to coordinate site visits to meet the successful applicant and see the results of the project funding. These visits will be coordinated in advance with the grantee, and the grantee should be prepared to show the work completed and how it aligned with the scope in the contract. These are casual visits and enjoyed by all parties. Now, right now, we do have a travel freeze on, so we can't travel. So we're sharing photos back and forth, and the grantees are providing before, during, and after pictures for us. And so hopefully we can start traveling in person again. So I'm looking forward to that. Next slide, please. So the project must be fully funded to proceed to scoring. So if you're just applying for grant funds, that's fine. But if it's part of a larger project, like a early learning facility is part of an affordable housing project, the entire other piece of that puzzle needs to be fully funded before we could award the early learning facility portion, because they have to show that that entire project can be completed. So applicants requesting $250,000 or more must be prepared to have their funds secured by real estate with a lien on the property to protect the state investment in the project. Additional details will be outlined in the notice of funding opportunity. All work estimates must consider the requirement of paying state prevailing wage as required by the public works statutes. And if unsure of a particular project falls in this category or contractors are using apprentices, the applicant can contact the Department of Labor Industries, and there is a link to that on this slide. So I'm not sure if the slides will be made available, or you can just contact me and I can get you that link as well. Next slide, please. So insurance is required to protect the state investment as in the project as well as the job site. Commercial liability, commercial property, and fidelity insurance are required. So if a business such as a family home has no employees other than a grantee, we may be able to waive the fidelity on a case-by-case basis. Builder's risk may substitute for one of the requirements also on a case-by-case basis. This is a reimbursement grant with no funds provided up front, and no funds can be used for deposits on work. Portions of the project may be submitted for reimbursement. So if the project doesn't need to be fully complete before submitting. And Commerce also has a plan in place to help support smaller organizations that may have cash flow challenges. So for these, invoices for completed work may be submitted to Commerce, and Commerce can provide those funds to the grantee, and then the grantee will have up to 30 days to provide proof of payment to the contractor or vendor, and then the process begins again. And this can happen as often as once a month. Next slide, please. All applicants must demonstrate that they have site security, meaning they are authorized by ownership or long-term lease to make modifications to the project site. They must agree to comply with enrollment in Early Achievers or Love It Way, and if not enrolled but intending to enroll, a Commerce monitoring team will conduct compliance checks starting 3 years after project completion. So we realize it does take time when you intend to enroll to when you're actually enrolled. So we understand that. All applicants must complete Governor's Executive Order 2102 processes, with the exception of tribes or project on their own land. There's a link to the site on this slide as well. Program managers assigned to the successful applicants will also assist with this process. Next slide, please. Remember that the amount being requested must be fully supported by bids, and that the contractors need to consider prevailing wage impacts and potential cost increases when providing bids. If a project ends up costing more than the estimates provided and the funds requested, the grantee will need to provide the difference to make up the funds to make that project complete. Having accurate bids and funding requests on the application is the best way to ensure the project aligns with the funding being requested. Next slide, please. Okay, now this is the fun part. We get to share some completed projects. Next slide, please. So this is Lumen Early Learning Center, and it was funded from the 2019-2021 biennium, and provided $573 in grants, and they matched with $275,000 of facility funds. This is a unique project that provided early learning for children of students at Lumen High School so that teen parents can continue their education and graduate with their high school diplomas. All of their slots were subsidized through Working Connections childcare. This site provided 60 early learning slots, and there are plans to expand to 120. Next slide, please. So we can't leave out the family homes. We love the family homes. This family child early learning center in Yakima received $76,000 in the 21-23 federal health and safety funding round, and completed a lot in the funding they received. Improvements included energy efficient windows, a kitchen upgrade, and more food preparation space and storage, as well as covered area for their play. Next slide, please. So I'm going to turn this back over to Tracy again. So thank you.
Thank you, Kristen. So the following slides are a reminder of DCYF's broader work in facilities. The foundation of our work, as I know that you may be aware, comes from the Access and Living Wage Plan and the newly published and upcoming Facilities Implementation Plan. Our work in early care and education facilities is foundational to the Access and Living Wage Plan to build an integrated early learning and education mixed delivery system. Next slide, please. The Access and Living Wage Plan's recommendations serve as our roadmap to ensure that families pay no more than 7% of their family income for high quality care and that the ECE workforce receives a living wage and benefits. We continue our work so that families have care that meets their needs, that the early care and education workforce is thriving, that systems are aligned in the mixed delivery system, and that there are adequate facilities to support access. Increasing affordable access to early care and education is a primary focus of DCYF, and to achieve that, we know that we need to increase early learning facilities. Next slide, please. The Early Care and Education Facilities Implementation Plan, it's a lot of words to say all at once, is an extension from the Access and Living Wage Plan, and that's specific to Goal 4, Objective 4.2. And that objective is to explore and implement new approaches to meet the long-term facilities needs to scale access for children and families. The final Early Care and Education Facilities Implementation Plan was finalized this summer. The final recommendations include 3 high-level goals. The first goal is public, private, and nonprofit sectors across the state coordinate and streamline ECE facilities development. And this is about coordinating the ECE regulatory landscape and increasing access opportunities for caregivers. Under this goal, we have strategies that include convening of an interagency ECE facilities work group, expanding current and past efforts of employer-supported care, and collaborating with local and state agencies to align ECE facility definitions. The second goal focuses on adequate financial resources and technical support for ECE facilities with strategies that include the creation of a toolkit that will include guides, provider journey and facility development, virtual tours and others in English, Spanish, and Somali, and increased support for technical assistance and licensing site feasibility review for providers and ELF applicants. And under Goal 3, ECE facilities development is supported by cost-effective solutions. We have strategies that include connecting with OFM and other state and local governments to look at pathways to lease or transfer underutilized space for ECE use. Next slide, please. The ELF grant requires shovel readiness via legislation to receive an ELF grant, but it also requires program readiness to be successful in not only the grant application, but also the life cycle of the grant. All new programs developing a space have the potential to be an ELF applicant. As an agency, we support individuals in becoming licensed childcare providers by offering clear guidance and tools to make the licensing process easier to follow. Our goal is to help providers meet health, safety, and quality standards while reducing unnecessary steps so families can access safe, reliable childcare. By supporting providers through licensing, facility development, and community partnerships, DCYF is part of the ecosystem that creates more stable childcare options across Washington. A stronger childcare system supports a child's development, helps businesses keep employees, and strengthens Washington's economy. Next slide, please. Oops, what's the slide after that? Oh, I'll start here and then we'll go backwards. DCYF receives funding through the legislature's ELF appropriation to provide personalized services as someone prepares to become a licensed early care and education program. Over the past biennium, the legislature has included a percentage for DCYF technical assistance. This allocation supports pre-licensing services and other facilities related support in the agency. This slide highlights the work of DCYF's pre-licensing team. The pre-licensing team supports providers to complete the childcare licensing application, and they provide information about opening and operating childcare throughout the state. We'll go backwards a slide. And also through the ELF appropriation, DCYF contracts with the Imagine Institute to provide language support to ELF applicants. Imagine is able to translate and interpret grant information and requirements in the applicant's preferred language. DCYF and Imagine are working together this fiscal year to develop additional grant supports for the 2027-2029 grant cycle. And we'll move forward 2 slides. And as we wrap up our presentation, we are open for questions and discussion. On this slide, there are 3 questions that we can discuss in any order, or we can take questions as you may have them from the presentation. Though, as mentioned, we might get back to you post this meeting. So I'm going to open the floor, bring Kristen back on if possible.
Right, so I did see that question about the tenure requirement. That's actually something we have no control over. That is set by RCW 4331-575. So we have to adhere to that tenure requirement. And the other question I saw, entering into agreements with local banks or credit unions. As a state agency, we're actually prohibited to like favor specific businesses and things like that. We can provide resources and links like to enterprise community partners where they can have grants and loans, but we can't, show favoritism or bias toward any private business. I'm trying to see if there are any other questions. Oh, I think this might be for you, Tracy. There's a question: where did the 7% goal come from?
I'm going to allow Diana Stokes to answer that one. She's online right now.
Yeah, thanks, Tracy. So the 7% that's part of the access and living wage, that is from the proviso language that was written in the legislation where families would pay no more of 7% of their household income. And then, as Tracy mentioned, the other half of the proviso focuses on living wages and benefits for childcare providers.
And so there's a reference to the securitization. We have late securitization for grants less than 250,000.
I see the question in the chat. Sorry, I'm scrolling at the same time from Jan about entering into agreements with local banks or credit unions to support with the cash flow challenges. I think that this is something that I'm not sure if Kristen has an answer to this, but I do believe that this is something that's being explored as part of our facilities project. And so there may be more information to come. I also see the question from Laura in the chat with the turnaround time for pre-licensing, and that is also something that we'll be able to follow up on post this meeting. Thank you so much.
Yeah, also with that, it all depends on how quickly we get the information from the grantee as well. So they could only be anywhere from 3 weeks to 6 months or longer. It just depends on how quickly we get the information. We're trying to make it so it isn't a barrier. We at the time of award, we have one email that goes out that has links to all of the steps that are needed, and they're directly designated with a program manager to help walk them through the steps.
Yep. And then from DCYF's perspective, we'll be able to follow up. Thank you. I'm going to keep the floor open. Oh, I see Senator Wilson.
Yeah, I'm curious what support might be available for individuals as they're actually applying as opposed to after they've applied. I know so many folks, this is not an area of expertise, but especially when you're looking for the acquisition of a piece of property or a building, and oftentimes we'll have folks say they found a great space and then have someone else go in and look at it with a bit of expertise and find out it's not at all a good space. And I know we had done some work with helping on the planning and the design and all of that. Is that support going to still be available, or how are we helping folks as they enter the system as opposed to after they have been awarded the dollars, if that makes sense?
That makes sense, Senator Wilson. Thank you for that question. That actually ties in directly to our facilities project and the recommendations that we have. We know our background is early childhood education and not always in construction and real estate and all of those other areas of expertise that's needed. And so one of our recommendations is how do we get those other professionals to be directly connected to more early care and education providers and have that partnership where they can help us with that pre-work. Of course, that requires additional funding in order to implement, but we are looking at strategies to support that technical assistance early on.
And I do know we've had some projects, so I'm hoping we're building on what we've already done and not starting from anew. We have a number of architects and a number of folks that have been engaged in the work. So just hoping that we can also share maybe and show those kinds of things so people know that work has already happened and it should continue as opposed to looking like something new, especially right now where dollars are critical and anything that looks like new is going to be off the table. And I just want to make sure that we continue the work forward and make sure it's connected. But thanks. I appreciate that, Diana.
Yeah, absolutely. And just kind of seeing what you're alluding to, we do talk about the capital readiness pilot project and how can we build and expand from that project based on our learnings. So yeah, we're excited for that.
There is another question from Jen in the chat. Kristen, I am wondering if this is one that you're able to answer on the spot or if this is a follow-up.
With the scarcity of, is it the one about the contractors?
Yes.
We don't require that. I mean, we recommend that people use local contractors, but we don't require it. We know we have some projects in very remote areas where they have to bring in contractors from out of the area. And they just need to include that elevated cost in with their bids, because we do know it costs more to bring material supplies and labor to those remote areas. Does that help? I hope.
Yes, thank you. That's a hopeful answer.
Oh, good.
Yeah.
So far, I think we've addressed or have a plan to address the questions in the chat. I'll hold on for another bit to see if any more come in. Thank you, Erica, for putting that into the chat. Erica says that Start Early Washington convenes an early learning facilities group that brings together providers, and she provided the contact information for more information. And checking back in with Dr. Nobles to say thank you so much for the opportunity if we're waiting for questions to come in, but also to give a minute to say thank you for allowing us to come and participate in the meeting and share about ELF. Our contact information is on the slide, both for myself and Kristen, and we very much appreciate getting to spend the afternoon with you.
Yes, thank you for having us.
Thank you both. That was really great information and very detailed. So thank you for your time and for all of the amazing information. Um, Okay, and just kind of as a reminder for those who may have questions afterwards, feel free to use the feedback loop. That's kind of what that is for, and we can get those questions answered via that way. Okay, as for the next presenters, just moving along, we're the topic is staff qualification updates. As another reminder, during the presentation, please type your questions or comments into the chat box. Once the presentation is over, we will answer questions as we can, as exhibited prior, and our follow-up via the feedback loop when needed, and open up for additional questions from the presenter, like previously done. Our next presenters are going to be Susie Enders. I hope I said that correctly. My apologies if not, and Brett Skinner. Brett Skinner is the Child Care Policy Manager, and Susie is the Staff Qualifications Coordinator. They're going to present on an update for Staff Qualifications Work Group as a part of House Bill 1648. And again, in reflection time, remember to share your feedback via the meeting reflection survey. That link would be in the chat for this topic. And with that, I turn it over to Susie and Brett.
Hi, thank you. I'm Susie Endersby, the Staff Qualifications Coordinator with the Early Learning Division, and I will get us started. If we could go to the next slide, please. The purpose of this update is really to share our progress on House Bill 1648 Staff Qualifications Workgroup activities and provide an overview about the proposed recommendations. And we'd like to gather feedback if you have some to share at this time and also respond to questions. There will be a couple opportunities to provide feedback in addition to us presenting today. The proposed recommendations cover the topics of compensation, data, staff qualification requirements, education access, education verification, navigation, the experience pathway, and our community-based training pathway, which is also known as PACE, and out-of-state training. Next slide. So kind of a snapshot of what's happened over the last few months. In our May meeting with the work group, we went over education access, verification, and training. And then in June, we discussed proposed recommendations around staff qualification requirements, education and professional development, navigation, and data. And then in July, we met to vote on the proposed recommendations. So the next slide, development of the draft recommendations. The recommendations are still in draft form. The work group remains responsible for refining them, and feedback from ELAC is intended to inform the work group's deliberations, but not replace them. The work group began with exploratory discussions on each topic and that were identified in House Bill 1648 to better understand the issues, opportunities, and considerations. Based on those discussions, DCYF developed an initial set of draft recommendations for the work group to review and discuss. The work group was able to review and discuss the recommendations in small groups during May and June meetings, providing feedback, identifying additional concerns, and suggesting revisions. And then DCYF refined the recommendations based on what the work group had shared and added implementation options and considerations, including whether recommendations could be implemented within existing resources. Throughout the process, DCYF has worked to identify areas where perspectives overlap, while recognizing the different viewpoints that remain across some of the topics within the work group. And I'm going to hand it over to Brett.
Thank you. So again, my name is Brett Skinner. I'm the Child Care Policy Program Manager. And I just want to thank everybody for giving us the time and for everyone who has put in a lot of effort into this work group, shown up in addition to other work that they're doing, provided feedback, provided questions. These next couple slides are really just trying to show the ways in which we've included feedback and we've come to groups like ELAC to inform, ask questions, keep connected. Because as you all know, the work continues even as we complete work that we've done from bills. So the staff qualifications work group, engages with these advisory groups, which includes, IPEL, provider supports, ELAC. And then we're going to have a summary, and then we have an executive steering committee that will, in the end, make some of the final decisions on what can and cannot be sort of completed. And what Susie mentioned also is that there's going to be a feedback opportunity where people can have a little bit more time to process what we're going to go over today and provide some more direct input and be able to sort of read and take your time. We kind of understand that everybody processes information at different speeds, so it'll allow people to do that. If you want to go to the next slide. This slide just kind of touches on some of the things that we have talked about, the methods of engagement. We talked about in October, the presentations and discussion, surveys, work group members panel, the synthesis of themes and the rationale for recommendations, and focus breakout discussions. December, we kind of talked about the experience with PACE, like how people have experienced that. In their workplaces or people that they're connecting with, what has been working, what hasn't worked, what is sort of absent from certain communities. We kind of gathered that from these different groups. And then in February, we talked about calculating experience, what is important to consider when verifying and recognizing out-of-state experience in Washington's early learning workforce for education and training. And what is important to consider when verifying and recognizing domestic and international education and training for Washington's early learning workforce. And then today, we're going over the overview of the recommendation draft. So hopefully we'll get a clear idea of what that is. So we can go to the next slide. So this slide is just a bit of a primer, something to think about as we go through these recommendations to, obviously whatever comes to mind, but these may help you think through questions you may have. So which recommendations require additional clarification? What implementation challenges or barriers do you anticipate? And where do you see any gaps or unintended impacts? So the second one, especially when we talk about the things that we want to do, there's always a lot of amazing ideas that people are bringing forward. But we do have to think about implementation and how do we make these things a reality and how do we work within budget constraints and work within our systems and our contracts to make these things become real. So things that we want to hear feedback on if they come to you. And you can go to the next slide. And you can go to the next one. This is just the proposed recommendations. So we're gonna kind of work our way through each of the groups that Susie mentioned. And so the first one is compensation and workforce stability. It's pretty impossible to not go through a work group and talk about the impacts that are within the field around compensation and funding. And so the work group, even though there weren't a ton of recommendations around pulling in different revenue sources and doing that, it was really important that it was brought to the table. And I think we're one slide too far ahead. Sorry. If we could just go back one. Yeah. So, building upon the recommendations of the Child Care Collaborative Task Force and the Fair Start for Kids Act, continue investing in competitive compensation and benefits for Washington's early learning workforce. Compensation is foundational to recruiting and retaining qualified early learning professionals. Low wages and low benefits contribute to workforce stoppages and turnover. Families already face significant childcare costs. Sustainable workforce compensation requires continued public investment. So that's just something that kind of needs to continue to be underlined and brought to the forefront. I know this isn't news to anyone, but important that we continue to highlight that. And we can go to the next slide. The second one is around data and continuous improvement. So we want to use data to monitor and continuously improve staff qualification pathways by collecting and regularly reporting implementation data using both quantitative and qualitative information to understand workforce experiences, engaging workforce members, tribal nations, and impacted communities in decisions about data collection, interpretation, and use, identifying barriers, disparities, and successful practices to inform future improvements, and reducing administrative burden while improving access to meaningful workforce data. So again, this was a continued conversation that we were having throughout the workforce group. We want to have informed decisions. We want to continue to have data that's going to help us make decisions that will help our workforce. And so a big part of that was coming up with a plan to make that meaningful, to be able to continue to show this, to just have transparency and meaningful metrics to continue to show everybody so that we can make decisions that make sense for everybody. And we can go to the next slide. Okay. So this is around, continuing around data, but and continuous improvement. So proposing inventory of existing data to identify what information is already available, develop a logic model to define what additional information is needed and how it will be used, share findings with advisory groups to gather feedback on data priorities, interpretation, and future policy decisions. Use data to support continuous quality improvement, identifying barriers, disparities, and opportunities for improvement. And review merit to identify opportunities to streamline data entry and improve visibility of workforce records for program administrators. And so some of the things, that we're wanting to look at is what workforce data would be more valuable, what information maybe is missing from your experience, how should D2F share data in transparent and meaningful ways, outside of it just being on dashboards or on our website. Are there more meaningful ways that we could do that? How can data collection better support providers while minimizing the administrative burden? So those are a couple things we want to keep in mind. And then I'm going to pass it back to Susie to go to the next slide.
The work group proposed recommendations around staff qualification requirements. The work group identified several opportunities to improve how staff qualification requirements are communicated and supported. These recommendations focus on making the requirements easier to understand, helping early learning professionals navigate their available pathways, and then connecting individuals with resources that they need to meet their staff qualification requirements. The work group also identified some broader areas that they would like to revisit, including the staff qualification framework itself, exploring the role of experience, competencies, and equivalencies, And because these topics would require changes to the Washington Administrative Code, or WAC, they extend beyond the implementation of House Bill 1648. And DCYF's immediate focus is implementing the requirements of House Bill 1648, which will include developing clearer guidance and resources, improving tools that help providers understand their qualification pathways, making it easier to access education, training, and the career planning supports. And then we've placed the future rulemaking considerations for exploring long-term approaches to the staff qualification requirements and reviewing the role of experience, competencies, and equivalencies. So they aren't necessarily being dropped off of the conversation. They're just placed for a later revisit. And the next slide, please. For education access, many of the recommendations align with work that's already underway. As DCYF continues to enhance the career planning portal, we will work to centralize information, education, and training opportunities across Washington's community and technical colleges, making it easier for providers to identify the pathways that meet their needs. The work group also highlighted the importance of reducing financial barriers. DCYF currently supports 2 scholarship programs that help eligible early learning professionals pursue education and credentials. While scholarship funding is subjective to legislative appropriation, DCYF will continue to monitor participation and use the available data to help inform future funding discussions. The work group encouraged a more flexible and responsive educational programming, including online, multilingual, and cohort-based options. And colleges do determine their own course offerings based on local needs and resources. DCYF and the Washington State Board for Community and Technical Colleges do partner with higher education institutes by sharing the promising practices that are working in different colleges, convening partners, and encouraging responsive programming across the state. The work group also discussed improving alignment between education pathways, including articulation of prior learning for credentials, such as the community-based pathway PACE, Child Development Associate, or CDA. And while articulation decisions remain with individual colleges, DCYF can support greater transparency by identifying which colleges have articulation agreements, sharing successful models, and encouraging continued collaboration among higher education partners. The next slide. For education verification and navigation, really about the education application process. One area of focus is increasing transparency throughout the education verification process. DCYF is working to enhance merit so that applicants can better track the status of their education application, to provide greater visibility of where an application is in the review process and reduce uncertainty for providers and supervisors. DCYF will develop a comprehensive education verification manual that explains documentation requirements, timelines, common processes, and available options, all in plain language. And another priority is strengthening navigation and individual support. The Merit System Navigation team already provides individualized assistance with staff qualifications, education training, and other merit processes. And DCYF will work to increase awareness of the resources among licensors, coaches, providers, and other partners who support the workforce. And the work group also identified several opportunities to improve consistency and communication, including establishing the clear timelines, simplifying waiver information, improving guidance for individuals with international education, and ensuring information is available in multiple languages. And then many of these improvements can be made through updated guidance and resources, while some others may require future system enhancements or additional resources. The experience pathway overview. This is just a reminder of how the House Bill 1648 was passed, allowing eligible ECE professionals to meet staff qualification requirements through experience, which requires 5 years of cumulative experience by August 1st, 2030. Experience is calculated through merit employment records, and it includes roles requiring the initial short or state certificate, and DCYF is also including school-age job roles. On the next slide, the work group proposed recommendation for the experience pathway. Members consistently emphasize that implementation should support workforce retention while making sure the pathway is inclusive, transparent, and as easy to navigate as possible. One recommendation was to recognize qualifying experience that is not currently captured in merit. And this would be experience gained in licensed childcare programs from other states, tribal facilities certified for payment, and military childcare programs. The work group also emphasized the importance of providing clear information about the experience pathway as early as possible. This includes explaining who is eligible, how experience will be verified, and how individuals can determine whether they qualify. Members recommended making these resources available in multiple languages and distributing them through trusted partners such as licensors, coaches, and community organizations. And then finally, the work group recommended allowing experience gained across different licensed childcare roles to count toward the 5 years of cumulative experience. Members expressed a preference for the broadest possible recognition of qualifying experience, noting that many professionals advance through multiple roles over the course of their careers. The next slide will outline DCYF's proposed implementation approach, including where it aligns with the work group recommendation and where the department is proposing a different approach based on policy consideration and implementation planning. So based on the feedback received through the work group process, DCYF is proposing an implementation approach that provides greater flexibility than originally contemplated. Originally, the individual's experience would have defaulted to the lowest level role they held during the 5 years of experience period. Experience instead will count toward across the roles that have similar responsibilities in two distinct established role groupings. So on the left is the teaching roles, and on the right are leadership roles. This approach also creates a clearer and more predictable process for providers and early learning professionals while supporting career mobility within each role grouping. So the 5 years cumulative could be in assistant teacher, lead teacher, or family homeowner and licensee, and they would be qualified for any of those 3 job roles. And on the other side, the 5 years within leadership roles could move between center program supervisor, assistant director, director, center director, program director, or site director. And then on the next slide, so for center-based leadership roles, DCYF is proposing an additional expectation that reflects the unique responsibilities associated with these positions. Under this approach, up to 2 of the required 5 years of cumulative experience may be gained as a lead teacher or licensed family homeowner licensee, and then the remaining 3 years must be in a center-based leadership role. This recommendation is consistent with Washington's current hiring requirements, which already recognize up to 2 years of teaching experience when qualifying individuals for center leadership roles. During the workgroup discussions, members expressed differing perspectives on this issue. Some advocated for allowing any combination of early learning experience to count toward leadership qualifications. And after considering the workgroup recommendations, the responsibilities associated with leadership positions, the intent of existing qualification requirements, and implementation considerations, DCYF is proposing to retain leadership experience requirement for center-based leadership roles. And then the goal is to balance flexibility for experienced professionals while ensuring that individuals qualifying through the experience-based pathway have substantial experience performing the duties and responsibilities of center leaders. I'm going to pass it back to Brett.
And I just want to applaud you, Susie, for getting through that. She was losing her voice a little bit, but powered through and did great. So the next piece that we're going to talk about, it says on the slide, it says in discussion, community-based pathway, and then it points to our PACE program. And so there was lots of conversation about PACE. And it seemed like there was different experiences for different members of the work group. And in some areas, they weren't even aware that PACE was sort of available, or they didn't have access to it in some ways. And so there was quite a bit of discussion throughout the entire work group as we looked at this. And so members emphasized the importance of strengthening alignment between PACE and the early childhood education stackable certificate pathway so that individuals have a clear understanding how community-based learning connects to credit-bearing education opportunities. The work group also encouraged continued conversations about the long-term future of the community-based pathways, including whether PACE should be enhanced, redesigned, or replaced by a different model that continues to meet the needs of the workforce. At the same time, DCUF will continue implementing and supporting PACE. Under House Bill 2556, the department is required to provide a non-credit bearing community-based training pathway that meets staff qualification requirements. PACE fulfills that statutory requirement and will remain an important pathway for early learning professionals. DCUF will continue working with higher education and community partners to strengthen connections between PACE and credit-bearing education and improve awareness of articulation opportunities where they exist and expand access to community-based learning opportunities for working professionals. As implementation continues, DCUF welcomes ongoing feedback from providers, higher education partners, and advisory groups about how the community-based pathways can continue to evolve to best support Washington's early learning workforce. And we can go to the next. So, this is a progress update on the continuing educational improvements. So House Bill 1648 directed the work group to develop recommendations related to out-of-state training. During the work group's discussions, members clarified that the broader issue is not limited to training completed outside of Washington. Instead, the focus was on how early learning professionals receive recognition for qualifying training that is not automatically recorded in merit. So this included out-of-state trainings, national conferences and professional development, trainings offered by organizations that are not state-approved trainings, and other qualifying professional development that requires an individual to request recognition through merit. Because of all these types of learning opportunities are all recognized through the continuing education proposal process, the work group's discussion expanded beyond out-of-state training to improving the continuing educational proposal process as a whole. So while these discussions were underway, DCUF independently reviewed the process and implemented several improvements that could be made that became effective June 1 of this year. So these updates align closely with what the work group's recommendations to reduce administrative burden and improve user experience. A couple of the key improvements include simplifying the application, reducing the number of required reflection questions from multiple questions to just one, updating alignment with the current early care and education and school age core competencies, and allowing applicants to upload supporting documentation directly through the online education. Looking ahead, DCUF will continue developing guidance that explains how the continuing education proposal process works, what documentation is required, and how training is evaluated. This guidance will be available without requiring users to log into Merit, making it easier for providers and employers to understand the process before submitting an application and not getting sort of more confused or needing to jump through other hoops to get that understanding. And if you want to go to the next slide, here again is just a reminder on which recommendations require additional clarification, what implementation challenges or barriers do you anticipate, and where do you see any gaps or unintended impacts. And I think here's where we just kind of want to hear if anyone has anything um, that comes to mind, and feel free to write in the chat. And then I am just going to kind of put in one further piece that, we will be sending out the information that's where you can almost fill it out in survey form, where you're going to have a chance to look um, at all the recommendations and kind of process at your own speed. And Susie, feel free to enhance or correct anything I said.
You got it. I think the draft recommendations will be sent out with a survey for individuals to really read through and have some time to digest all of it and then respond.
Sorry, I was trying to lean into the uncomfortable silence as long as I could. Um, okay, so maybe I'm not following all this because it's my first time in this conversation, but if 3 years of leadership experience is required for leadership roles, how does anyone ever move up into leadership?
Well, are you asking if they need 3 years of experience in leadership to be promoted into leadership? Okay, I can answer that. I apologize. I wasn't very clear on that slide. What we're saying, so to be promoted into a leadership role, you're supposed to have 2 years experience as a lead teacher. And what DCYF is moving forward with is that if you have 2 of those 5 years required to meet experience, 2 of them as a lead teacher or a family homeowner, and then you're promoted and you only get 3 years or 3.5 years in center leadership by August 1st, 2030, you would have 5 years total, which is the requirement of the experience. 2 years could be as a lead teacher or a family homeowner, as long as the other 3 are in a center leadership role. You don't need experience in a leadership role to be promoted. That was talking about the 5 years total to meet the staff qualification requirements to be a center director, assistant director, program supervisor. Does that answer your question? Okay.
And Courtney said, I appreciate the work of this group. I'm concerned that more clarity and transparency were the main recommendations and what that really will look like. It's a good point. If there's anything specific, you have curiosities around, definitely feel free to, send that in. And as you look at the survey too, hopefully that will provide more clarity and ability to read I mean, Susie and I talked a lot today, and it is just a challenge to kind of like get through the depth of what the report is going to kind of like go into, um, without completely sort of boring everybody in a meeting like this. So hopefully that will provide a little more clarity, and then you can definitely provide feedback or questions, or if you have any now that you know. Okay, and then Laura said, did you discuss staff turnover after they complete training requirements? Currently, I have staff that go to college, then leave to work somewhere else, like a school district, that has more funding to pay them more. Currently, we fund their education, and many leave in impoverished, highly subsidized areas. Oh, live in.
Staff turnover has been a big topic around all of our work group meetings. And we are trying to take that into consideration when we look at funding for scholarship and training opportunities for individuals. Um, we we aren't looking necessarily at how to like reduce staff turnover other than trying to ensure that the workforce is prepared um, for working with young children and families and understanding that there will be staff turnover and what requirements and trainings really should be taken first to prepare somebody for that work. Um, but what we can do with the House bill is look at the data of knowing there is turnover and making sure that we are offering enough trainings going forward and enough scholarship or funding opportunities to cover as new individuals enter the workforce.
And Laura, I mean, your point is well taken. And I do think when we talked in the beginning about funding and that being an underlying emphasis, this definitely falls into that category in terms of, how do we keep staff here, working here when they get enticed into those other opportunities. So thank you for commenting that. Senator Wilson?
Yeah, I was just curious how this might connect to the Workforce Standards Board work we're doing around thinking about and also the true cost of quality as we think about what it costs to not only bring people on, but to sustain and maintain and retain them. And if there's some connections to some of the other work we're doing, so it's tied in and we're kind of tightening the weave on the why. And so, and we're probably already doing that, but sometimes we just talk about things in isolation of other things. And so I think this is one of those areas where it's really important to tie it to the importance of the other bodies of work that are also happening, because it's all kind of tied into that, if you will. Just a thought. Thanks.
Yeah, well said. Okay. I'm going to talk for a second about what's coming next with this, but feel free to continue it in the chat or in the follow-up to this. Um, there's going to be that the feedback opportunity that's going to be coming out to people that we mentioned in the presentation. And what will happen is we'll take that information. There's going to be a couple weeks to send that to send in the information, and then we'll still be meeting with the work group to kind of go over some of that feedback so that they aren't sort of all their work isn't just completely displaced or thrown out, like that they're a part of looking at that information as well. And then there are some timelines that are built in terms of what we need to do to get the final report completed and submitted. And so those things will be worked on in the coming months so that we can get that all set forward. And then it says, focus moving forward, improve clarity and access across all qualification pathways, strengthen alignment between education experience and training systems, and reduce barriers, improve navigation for AC professionals. So big points of emphasis there. And then I think the last slide is just thank you for listening and showing up and all of the hard work that you're doing. And continuing to provide feedback and efforts and in the field. So I think I can turn it back over to you, Brian, or Tiff, if you had anything to say. Oh, Nicole.
Yeah, thanks, Brett and team. And I just wanted to take a moment, I think, to thank all of our providers and others who participated in this work group, and just really thank ELAC and provider supports for being here with us as we've talked about these pieces, and of course IPEL and some of those other things. And just want to acknowledge, I think, some of the comments from Courtney and Senator Wilson. All of this is connected, and I think, as we've gone along this journey, I think it's really helped us get more clear in the data that we have available, get a better understanding of our workforce, and really think about how we want to support them in moving through the various pathways. And so I think this report gives us a solid foundation to do that, and then be able to connect back to some of the access and living wage work, the cost of quality care model, and certainly Senator Wilson, what do we know from this that we need to take into conversations in the Workforce Standards Board as that gets started. So just acknowledgement that the team's done a lot of work. I think providers have highlighted a lot of things for us to consider. And while it might not happen immediately, I think it's leading us down a path of getting to a much better picture and more clear picture and more accessible data as it relates to our workforce.
Great. Thank you so much. I definitely tend to agree. It's definitely eye-opening. And thank you for your words as well. Okay. And just as a reminder, we will have the feedback loop. And so if there are things that come up for you or questions or, further clarifications that you need, feel free to use that as well. Next is going to be the ECAP expansion topic. It's going to be presented by Kim Burgess-Sims. As a reminder, during the presentation, please type your questions or comments into the chat box. Once the presentation is over, we'll answer questions as we can, or again, follow up via the feedback loop when needed. So our last presenter is Kimberly Burgess-Sims. She's the ECAP Senior Administrator who will provide updates on the Pre-K Promise Subcommittee and saturation information related to outreach. As a reminder again for reflection time, please feel free to share via the meeting reflection survey, which is also provided in the chat. And with that, I will yield to Kim.
Thank you so much. And thanks, everyone. I actually have a fairly brief update today. It's great news on the Pre-K Promise ELAC subcommittee and the members who were selected to participate in that and to advise DCYF on our ECAP expansion plans. Before I jump into that, I did want to circle back on an ask that you all made in the spring for us to highlight for you where ECAP is expanding across the state. And so if you go to the next slide, it shows actually a really great picture of where our slots are being expanded and added this school year. So with the Pre-K Promise account and the opportunity to expand ECAP, We have a total of 16,835 ECAP slots that were awarded for the 26-27 school year. That is approximately 2,500 above the 2025-26 school year, and an addition of 2,630 more school day slots. This is a really significant expansion, and it's occurring in 101 of our current ECAP sites and 55 new sites across the state. So this is not a map of saturation. This is simply a heat map that provides a quick view of where those ECAP slots are being added as a percent increase above current ECAP slots by county. So you can see here that in 3 counties, Pacific, Thurston, and Skagit, the number of ECAP slots actually increased by over 50% in those counties. So that's really exciting to see. In 3 more counties, the kind of in-between medium color, Whatcom, Pierce, and Klickitat, the number of ECAP slots increased by between 25 and 50%. And in the remaining counties, the number of ECAP slots significantly increased in many cases, but did so by less than 25%. And there were some counties where we didn't see ECAP expansion in this first round of Pre-K Promise Fund expansion, but we do know that many of our contractors and others are expressing interest and are thinking and planning for longer term expansion and looking towards the next school year. So this is just an at a glance. Wanted to provide you with something you could take a look at now as we're preparing for the ramp up to the new school year. We are paying some really close attention to how our estimates of ECAP and pre-K saturation will change based on this initial expansion that's happening. That will take us a little bit more time because we're going to be updating that ECAP pre-K saturation study over the next several months, and we do plan to release an update on saturation by early this winter. But this quick look just gives you a sense, at least, of where we're expanding, and you can look at that saturation study data from our last saturation study report and kind of compare with where these slots are going to. And we're using this information to do some targeted outreach and really focus on building capacity of providers in the areas that we know have a low saturation so that we can bring on more providers and access for families in those communities. So that's just a quick update on where we are with expansion, which is exciting. On the next slide, I'm just going to share a few more slides on our Pre-K Promise ECAP expansion subcommittee. This is a really exciting opportunity to be expanding, and we really want to do this expansion planning in partnership with those of you who are most impacted by the changes in the expansion. So we set out this spring to engage an official subcommittee of ELAC to provide that diverse perspective and expertise to inform our plans and strategy. We really want to co-create with you all a strategy to increase capacity and expand ECAP to create those 10,000 additional slots with the Pre-K Promise account funding, and really to further expand to reach entitlement for all children and families by 2030-31 school year. So the next slide shows the groups that we sought out to have represented alongside the number of nominees that were selected who represent these different groups. We have several nominees who were selected who cover multiple groups, so that's why you'll see larger numbers in some cases than what we were looking for at the outset, which is great to see the representation we had. We had 68 nominees. So that was exciting. The level of interest in participating in this work with us was very high, and there were 28 members who were ultimately selected. On the next slide, I will share the full list of selected members, but first just wanted to briefly talk about the selection criteria and review process that resulted in the membership list that we will share. So our review team's goal was not to rank individual applicants. We had really phenomenal nominees and would have loved to have had all of them engaged, but we also needed the group to stay manageable. And so the team really looked to assemble a group that collectively represented a diverse set of expertise and perspectives and the geographic diversity across our state that we need to support successful implementation of this expansion effort. It was really a challenging task for them to really thoughtfully look through all 68 of the fantastic nominees. And ultimately, the review team did have to make some difficult decisions to ensure we had an overall balance of groups represented and lived expertise that aligned with those groups we sought out to engage and really represented the diverse geographic and community diversity across our state. For example, looking for a balance of urban, suburban, and rural contexts, and really to include providers that serve diverse populations and bring a unique perspective on local needs and those who might be otherwise underrepresented in some of our statewide planning efforts. So on the next slide, you'll see the list. Very excited to welcome all of these members and to work with you all. This list highlights our new Pre-K Promise ELAC subcommittee. In addition to the rich diversity of perspective and experience that each of these individual members bring, I did want to highlight that 9 of them are really statewide representatives who are representing organizations that have a reach across the state. 4 of these leaders are tribal early learning leaders. 7 are from the east or central regions of our state. 12 are from the western region of the state. So we're really excited about the diversity and the regional representation that we have. Our first meeting with this group will be in late September or early October, and we're working with them to schedule. And as I mentioned before, this is a long-term strategic planning effort over the next 10 years to continue to expand ECAP, and we look forward to the partnership in developing our strategies and working together. But it is not the only way that individuals can have input in our expansion plans. This broader ELAC group obviously is a really important place that people can provide input, and we will continually come back to you all, to IPEL, to many other groups that we have already engaged to seek input and support as we further develop our expansion plans. So thank you to each of you who are on the subcommittee, and for all of the people who are interested. We have circled back with those who were not selected as well to offer to meet with them individually and remind folks of the many other ways that they may be already engaged and could continue to engage with us on planning. And that's all I have today, unless there are any questions.
Great. Okay. And just as a reminder, you can submit any questions as they come up through the feedback loop, which is another good way. That's exciting news. It's really good to kind of end with, this positive high marks to see growth throughout the state. Really good. So thank you for that, Kimberly. And thank you all. Every presentation was extremely enlightening. I got a lot of information and very informative. Just thank you all for your time and dedication. I'm reminded of how lucky we are to be in a state that is doing extremely good work, despite any, challenges that may arise when they arise. So thank you. If you haven't taken the time, please fill out the reflective reflection survey. This helps us collect feedback and improve our work. Again, that link is shared in the chat. All 2026 meeting dates and information on the new ELAC office hours are posted on the ELAC website. And as highlighted, the next office hours is scheduled for Friday, September 25th from 11 a.m. to 12 noon. And we hope to see you there. Our next ELAC meeting will be Tuesday, October 13th, and we look forward to seeing you there. Thank you all again for joining us today. And with that, have a great day. If there's nothing else, the meeting is adjourned.
Thank you.
Thanks, everyone.